I would like to call the Finance, Ways and Means Committee to order for February the 25th, 2026. Madam Clerk, please open the board for roll call. Has everyone recorded their attendance, and does anyone need more time? Madam Clerk, please take the roll.
Mr. Chairman, you have 15 members present. You have a quorum.
All right, thank you very much. Members, any personal orders or announcements? Let's go to Chairman Hawk.
Thank you, Mr. Chairman, and members of the committee and folks watching. One of our colleagues, Renee Jones, Monday evening got a message that her 35-week pregnant daughter was having some slight complications. So she drove home Monday night, and there is a distinct possibility that Renee Jones, Representative Jones, may become a grandmother in the next few days, or if not, in the next few hours. So if we could keep Representative Jones and her daughter Laura in our thoughts and prayers as we go throughout our business the next couple of days. Thank you very much, Chairman.
All right, thank you, Chairman. Thank you for this. Next on the list, Representative Gant, you're recognized.
Thank you, Mr. Chairman. I have a special guest with me today, David Perdue from Germantown. David, if you'll stand up and let us welcome you.
All right. Welcome to the committee, and welcome everyone else as well. All right. Any other personal orders or announcements? Hearing none, seeing none. We do have a total of 6 budget hearings today. We're going to begin with the Division of TennCare. If you guys want to make your way up to the front. Members, again, please refer to your dashboard for the presentation material. And to our presenters, we will control the microphones. You'll see that red light come on, and then you will be ready to start. Without further ado, without objection, we're going to go out of session. We are out of session. And with that, I'd like to welcome Director Stephen Smith here this morning. Would you please begin with the introductions and who you have with you? Thank you again for being here.
Thank you very much, Mr. Chairman, members. It's good to be with you all this morning. My name is Stephen Smith. I serve as the TennCare Director. To my right is Zane Seals, our Chief Financial Officer. To my left, we have Katie Evans, our Chief of Long-Term Services and Supports, and then Dr. Victor Wu, our Chief Medical Officer. As you all heard me say in our October presentation to this committee, TennCare is more successful today than at any point in its 30-year history. It really is a remarkable turnaround story. It's a story that is reflected in this slide, and one that required difficult decisions, perseverance, and self-control from many people and leaders over decades, and none more important than this committee. Those efforts took us from a place where the TennCare budget was bankrupting the state to one where we now have record investments in TennCare, while at the same time, record investments in public education and so many other priorities within state government, and that is not a coincidence. Perhaps there is no greater evidence or confirmation of our program's success than our most recent innovation known as TennCare 3. It is a first of its kind shared savings model that rewards Tennessee for its responsible and conservative management of its Medicaid program. Since the inception of this waiver, which still today has not been replicated or even attempted, we have had the largest TennCare investments than any other similar time period in Tennessee history. More services provided, more people served, and record provider payments. In just the first 4 years of this 10-year waiver, we have achieved and secured more than $1.3 billion. And as we committed to do from day one in partnership with the General Assembly, we have reinvested these funds in ways to improve the lives of the people that we serve. That is an incredible accomplishment, but it's important for me to stress that it's not a TennCare accomplishment, it is a Tennessee accomplishment. It's one that we can all be proud of because it doesn't happen without everyone involved, from government to our health plans, to our many stakeholders, and of course, certainly to our medical providers who make that direct connection with our TennCare members every single day. As we move into specific budget requests for fiscal year 27, I want to start with our year 4 shared savings plan and our latest innovation for your consideration. It's a pilot program that we are calling Pathway to Independence. Today, Medicaid programs throughout the country, including TennCare, we spend a lot of time talking about how to help people get onto Medicaid. And those are important conversations to have. But we need to spend more time talking about how we can transition people off of Medicaid. not in a punitive way, but in a way where we can encourage and incentivize people to improve their own lives through work and higher pay and better jobs. The Pathway to Independence program is designed to directly take on this challenge. Here's what we know from both national and state and local research and analysis. We know that government benefits cliffs impact behavior. They prevent Medicaid members from seeking and accepting increased income opportunities. We know that through the work of our sister agency, DHS, that a large percentage of people that are experiencing benefits cliffs, they would take a better job if they had financial assistance to help them through the cliff, even if it meant losing their government benefits. We know a high percentage of Medicaid members who lose benefits due to higher income, they churn back onto Medicaid just a short time later. We know that when people come back to Medicaid after leaving, nearly 80% of them are uninsured before re-enrolling back into Medicaid and TennCare. That's a fact that creates even higher costs to the states and to Tennessee taxpayers due to pent-up demand and medical needs. We also know that when former Medicaid members are enrolled in private health insurance, the chances of them returning to Medicaid are greatly reduced, even if the cost of private insurance increase. So what can we do with these facts? Our plan creates a 4-year pilot that will support families by providing parents who term from TennCare due to increased income with time-limited, capped private health insurance premium assistance. We will provide 12 months of assistance up to $2,000 total, limited to those who do not exceed 250% of the federal poverty level. Now, we want everyone to participate to have some financial responsibility, so we will require each person to pay $15 per month unless his or her actual premium is less than $15 a month. That's important because part of the goal here is to help people grow accustomed to the private health insurance market. It's not just about that financial piece, it's also about the navigation. For the large majority of the participants in this pilot, $2,000 will pay for the remaining premium amount. And if at the end of the 12-month period, the participant has not expended the full $2,000, we will reimburse verified cost-sharing medical expenses up to the remaining amount. So we want to provide an opportunity, an incentive, and remove a key barrier to accepting higher income. And then we want to help prevent that churn back onto TennCare by helping people secure and navigate and grow accustomed to the private health insurance market. Now, I want to be fully transparent with this committee. We don't know if this is going to work. No state has attempted this. Certainly no Medicaid program has attempted this. But earlier I talked about another program, TennCare 3, that no other state has attempted, and it has exceeded even our highest expectations. I do know this: if this pilot is successful, it will be transformational. It will improve people's lives, and it will result in tremendous compounded savings to the taxpayers of this state. No one disputes that the rising costs of healthcare and government entitlement program spending in this country are unsustainable, even here in Tennessee, where we are universally recognized for strong management of our budget. We can continue to talk about that reality, and we can stay frustrated and frozen by it, or we can try to do something that could be a model for the rest of the nation. We hope to do the latter, and we ask for your support. Moving to other line items in our budget request, you'll see that really, other than the shared savings items, our requests reflect primarily mandatory costs, most notably medical inflation and utilization. And we're happy to talk about that as we get into the questions. I will point out that you will see several shared savings items that are listed, but almost all of those were part of the previous year's shared savings plans, and they were spread out over multiple years. So we discussed those in prior year's budget presentations. I realize I'm over my time, Mr. Chairman, so I'll close here. I do want to acknowledge that despite the accomplishments that I noted today, we know that we must continue to improve. Medicaid is difficult. Our challenges are not going to get any easier. That TennCare turnaround story that I began the presentation with, that story is not finished. This may be the last year of this administration, but we have much more to do, and we look forward to closing strong. So thank you all very much.
All right. Thank you, Director Smith. Thank you for your presentation, your opening statements. Got several folks on the list up here, and I'll kick us off with some questioning. Talking about the Medicaid rates, as you kind of have alluded to throughout your presentation this morning, and considering a little bit of context to my question, again, thinking about recent CMS guidelines dictating that TennCare should begin lowering state-directed payments by 10% each year. And again, that's beginning in 2028 until they reach 110% of Medicare rates. Of course, obviously, this change would affect the assessment system that is used to annually supplement healthcare facilities funding. So with that kind of as the backdrop, what is the current Medicaid relative rate relative to Medicare rate?
Well, it's going to depend on the particular provider. I think the one that we think about the most, because it's the largest and it's the group that will be impacted probably the most by the federal law that you referenced, is hospitals. As you all know, you worked to pass an assessment bill, and we worked with THA. We all worked together to actually infuse the largest amount of TennCare dollars into the system that we've ever seen. So that happened. We got approval for that last year. And so right now we have a very large directed payment that is going out to hospitals. It's almost $3 billion. And as you alluded to, under the federal law, beginning in 2028, we're going to have to start reducing that by 10% a year until we get down to 110% of Medicare. I think, it's really hard to know what things are going to look like when we get to the end of that 10-year period, because we have to consider that Medicare rates are typically going to go up every year for hospitals. But it also is possible that when all that is said and done, we will be back to where we were prior to the directed payment. So we're pretty close to that 110% right now is what I would estimate, if that makes sense.
Yes. And so how will provider payments be impacted?
Yeah, so provider payment, those dollars go to providers. So when we think about the rates that are going to providers, the payments that are going to providers, you have the rates that are negotiated with the MCOs, with our health plans, and then you have the directed payments on top of that. And so that will result in lesser payments to providers beginning in 2028, because we'll have to reduce. Now, CMS, they're going to look at the total. They're looking at the total payment. It doesn't matter to them whether it's through the MCOs or through the directed payment or assessment. They're going to look at the total amount.
And then looking a little bit further, what about kind of at the local level? What about the hospitals? How will this affect the assessment, which in return will affect the local hospital? So what does that look like? What's the effect on those?
Well, it will. It really will be up to the hospitals to determine what they want to do with the assessment. Again, CMS is going to be looking at the total payments, and we've got to get down to that 110% of Medicare. It's very possible that the assessment will be reduced because that assessment ultimately results in the higher payments to the providers. But a lot can happen between now and 2028. A lot can happen between now and 2038. And so it's just really hard to predict exactly what the finances will look like. It's also very hard to predict what actions a particular hospital will take resulting from the lower payments. Zane, do you want to add anything?
Zane Seals, Chief Financial Officer. So HR 1 does not have a direct legal impact on the assessment itself. To Director Smith's point, in Tennessee, it has an impact on the directed payment that's funded by the assessment. Since we're a non-expansion state, that's how it works in Tennessee. So that will, to your point, that will start being reduced by its 10 percentage points per year starting in January of 2028. Actually, the mathematical methodology for that is undefined at this point. CMS is going to issue, we think, a rule later in calendar year 2026 to tell us exactly how that math is going to work. So right now, nobody knows exactly how the math's going to work. But when that starts coming down, there is a possibility that we would get to a point where the assessment would start to draw down as well, because we would not have available federal match to leverage all the dollars that are being raised by the assessment. So it's kind of a waiting game to see what's going to happen once CMS issues their final guidance later this year. But it's certainly a possibility that that assessment will have to draw down commensurate with the amount that the directed payment is drawing down.
Okay. And then my final question, on average, what are physician, the reimbursement rates, just on average?
I don't think we have, if you're asking in terms of relative to Medicare, do we have that?
So those are not at 110% of Medicare. So those are not going to have to come down as a result of HR 1.
Yeah. I will say that if you look at over the last 8 years, for example, you look at our physician rates relative to the rest of the country in terms of increases, we've actually doubled the national CPI. So relative to the rest of the country, we're doing pretty well on physician rates over these last 8 years. If you look at the last 5 years, we are at 3.5% average increase year over year compared to the national CPI of about 1.9%. So we've done very well as a state over these last 8 years, and certainly the last 5.
Okay. All right. Thank you. Next on the list, let's go to Chairman Hawk. Chairman Hawk, you're recognized.
Thank you, Mr. Chairman. Director Smith, thank you. Chairman Hicks, with your indulgence, I'd like to go down a bit of the pathway that you were just on and to talk about physician reimbursements. And Director Smith, you and I, we've been friends for 25 years, and we've seen this, seen the accomplishments that you mentioned at the beginning of your program. I continue to worry about the tension that we've got between medical practitioners and reimbursements, and it's becoming even more and more of a challenge in our rural areas. The less populated area have less opportunity, less choices for physicians, and it does become a challenge. So you had mentioned, I think I heard you say, an aggregate increase for providers, essentially. And is there a way to designate, or do you have data that shows how much goes to rural providers versus urban providers? Is that a document or a dollar figure that you can quantify for us?
I don't have that today. I do know several years ago, I think Chairman Terry had asked us to look at that for physicians specifically. And when we looked at, we actually looked at relative to the Medicare rate, so we could get a percentage rural versus urban. And it was very, very similar at that time. I'd have to go back and look at what that was, but I do know there wasn't a large discrepancy between urban and rural, at least on that was for primary care physicians. I do need to specify that was primary care.
Okay. And on that, what reporting is required of MCOs to ensure that funds appropriated for provider rate increases are reaching the intended providers? Is that in any of the documents that you give us in the General Assembly?
Well, there's not a report. There's not a particular body that we have to submit something to that determines whether the rates that are being paid are sufficient. What is required is that we have network adequacy. And so the kind of the principles behind managed care are that you let the market drive the rates, and that's worked very well for us. But the determining factor is, do we have providers for our members to see, and is there an adequate network?
Chair, if I could, and that goes back to the network, what you just mentioned, network adequacy, the tension that many of us hear and feel in our communities, that doctors are no longer accepting patients that are on TennCare. And the dental benefits in particular. Our neck of the woods in Northeast Tennessee, we have very few dentists that are seeing these youth, the children patients, because of the reimbursement rate. So we're feeling some pain in our neck of the woods and other parts of Tennessee. I don't want to specifically talk. I just know my area a little more so. So we are feeling pains that I have a constant concern that the adequacy of providers is not meeting the need of our constituents. So I want to encourage us to continue to pay attention to all sides. Sometimes we say both sides, but there's many more than two sides in this conversation. It's multifaceted, and I want to encourage you to do that. If I could, Mr. Chairman, as you mentioned the innovation pathway to independence, I love it. Thank you very much. We have been innovative in what we've done with TennCare. The shared savings plan from 6-7 years ago being an indicator that we're leading the country in innovations like this. And I certainly hope that 4-year pilot provides another success for us as we go around. Our next budget hearing, we're going to be hearing from the Tennessee Department of Human Services, and they're working on these TANF programs, these pilots for TANF, and the wraparound services therein, and creating milestone reimbursements for, number one, staying off public assistance, or as you're describing in the pathways to independence, getting off public assistance and staying there. This is a workforce development issue for us, ladies and gentlemen. This is something where we've got to get more folks into the workforce and stay in the workforce to go seek out that private insurance and how to navigate that through either their employer or some other private mechanism. So I certainly applaud that effort, and we'll be supporting that 100%. I do want to go down on the slide you've got on the screen there. Item number 5, the Health Starts Initiative. The total funding, $23.7 million with $11.4 federal and $12.3 million other funding. Talk a little bit about this, the closed loop referral system in this initiative, and the metrics to track and to grade this, as well as the sources of funding and what we're going to do if this funding and when this funding runs out. So 3 questions there,
Yeah.
Director.
Yeah, sure. I'm going to defer to Dr. Rue because he and his team have been intricately involved in this, and he'll have a lot more of the details.
Okay. Victor Wu, Chief Medical Officer. Chairman, thank you so much for the question. And it's an area where we've been very excited to work on tackling whole person health for our members through the Health Starts Initiative. Just as a quick reminder, the 3 areas we've been spending a lot of time on thinking about are one is the Tennessee Community Compass, or the closed loop referral system, as you mentioned, which is up and running and live now across the state. The Tennessee Community Compass is a free resource for all of our Tennessee citizens, including our TennCare members, if they wanted to go and search for resources such as food banks, job trainings, housing supports that are local to their community. We know so many of our local communities provide supports through nonprofit organizations, through faith-based communities, and getting that information out and just the volunteer spirit of our Tennessee citizens to help each other is one of the areas where we've seen a tremendous amount of success. Our health plans are using it, and our provider communities are using that service as well. And that's an area where we continue to see a lot of great impact. And it's also one of the key ways that we're tracking data. It's allowing us to determine how many health-related social needs are being identified, how those are being referred, and how many of those needs are being met. And one of the evaluation points of our pilot is to look at how those types of whole person health interventions can drive down in the future inpatient admissions or ER use or healthcare utilization that may be avoided. We're early in that process. The data piece is we're still learning how to take that data in from the Tennessee Community Compass, but it is one of the pieces of our long-term roadmap for the Health Starts evaluation. That's one of the big pieces. A second big area is around provider partnerships. We've had tremendous success partnering with primary care providers, SUD or OUD, opioid use disorder providers, hospital systems, OBGYN providers, and helping those clinics, those hospitals begin to identify how they can bring their own resources, training, workflow changes to supporting members in the community and in their practices. Those dollars are oftentimes one-time or two-year funding to really build infrastructure, to build that mind share, to support and catalyze the work. And then those hospitals and providers have all made commitments to sustain the work on their own. So those are dollars that we're not looking to bring additional dollars in the future, but how can we increase that capacity, help these providers, these hospitals build systems, make investments in their electronic medical record, create systems that can be sustained, but given that catalyst, that infrastructure dollar to really make that go forward. That's the second area. And then the third area we really focus on is workforce development, really looking at places like community health workers in the community. How do we stand up some work around bringing new types of supports to tackle that whole person health? And we've seen some great successes there as well. Hope that answered your question, but happy to follow up with anything else you wanted to hear about.
Chairman Hall?
Thank you. And it did answer my question. I think offline we can have some more conversation too. I know we're spending all week in budget hearings, but I'd love to have an extra hour with you guys. I'll be very frank. So thank you, Chairman. I'll pass to the next.
All right, thank you very much. Next on the list, Leader Cochran, you're recognized.
Thank you, Mr. Chairman, and thank you all very much. Had a quick question just on the Medicaid management information system. And so I know the budget proposed by the governor this year, it includes $25.8 million non-recurring for that system. So $102 million, though, in state funding has been allocated to the system since fiscal year 20. So with $23.5 million of this as recurring funding, the federal government just recently, they changed their guidelines on spending, which has set the completion date for the system to January 2027, I believe. So can you just kind of give us a little bit of an update on this system? So what is the new completion date for the system? And then how much money will the state save due to the new federal guidelines? I know that I threw a lot at you.
No, we got it.
Great. Thanks for your question. So you are correct that the federal government has changed some guidelines. When the second Trump administration came into office, they offered some new flexibilities to states that previously had not been available to us. It was specifically related to how the MMIS system, which is Medicaid Management Information System, is constructed. And for those of you that aren't aware, that's basically the brain of TennCare. It's where all our data is, provider data, claims data, our expenditure data, everything. They have allowed us flexibilities to move away from a modularization approach. What we found is that over the past few years, the modularization approach nationwide was not saving nearly as much money as everybody thought it was going to. And so when they offered those new flexibilities, we pivoted and we went away from our prior procurement strategy. So that did set back the completion date. If we had stuck with the prior approach, we would have been completed sometime next year. We think that's going to save us tens of millions of dollars over time, switching to this new approach. But what it required us to do is essentially scratch the procurement that had been baked and ready to go and build a new procurement that was consistent with this new strategy. So it's going to push back the completion date of the MMIS system probably by about 3 years or so. But again, the uptake on that is it should save us tens of millions of dollars over time. Also, I would note that our IT budget is now kind of crested the hill. This budget that we're presenting before y'all this year is down from the peak and will continue coming down over the next 3 to 5 years.
And then just one follow-up, Mr. Chairman, if you don't
Yes,
mind.
sir. Go right ahead, Leader Cochran.
Just one last thing. What's the lifetime of the system? What's the lifespan of that?
That's a great question. I don't know that I can tell you that for sure. What I will tell you is the current MMIS system, by the time it's replaced, will be about 25 years old. I don't know what technology is going to look like 20 years from now, but typically you can think of a system this large as having a pretty extended lifespan.
Okay, thank you. I appreciate it.
All right, thank you. Next on the list, Chairman Williams. Chairman Williams, you recognize.
Thank you, Director, for coming. Thank you for always being accessible. I know you and I have spent entirely too much time in the office this year, it seems like. But it seems like I'm the guy who's constantly trying to find what's transformational in the rural transformation application. And so my question is regarding that. I noticed you had a couple of positions, 2 positions that were assigned to you for the rural health transformation application proposal that for that first tranche of $207 million. Could you tell me exactly, what one of the big hesitations I have about the Rural Health Transformation Act is that we're going to inadvertently create recurring revenue issues come year 6 after it's over. And so knowing what those folks are doing in your department, I think would be helpful for us to kind of better understand that and what their role would be.
Sure. Appreciate the question. I'm going to have Victor talk about that in a minute. I will say that the pieces that we are owning from the Rural Health Transformation Fund, they really focus on value-based payments primarily, which I would argue that is transformational. It's a different way to pay providers and to pay based on quality. So we're excited about that. The other thing I'll point out too is that you won't see it in our budget, but the other large piece of our shared savings from year 4, it's $125 million. It shows up in the Department of Health's budget, but those dollars are really meant to serve rural communities in ways where we could not use the Rural Health Transformation dollars. So infrastructure or capital, for example. And so we're also excited about that. But Victor, do you want to speak to the pieces of the transformation fund for us?
Yeah, thanks for the question. I'll make one comment that specifically address the 2 positions you were asking about. To Director Smith's point, we do think that through the TennCare model and the application process, we're very excited about the use of value-based payments, especially in the rural communities. We know that value-based payments for our larger program in TennCare have really driven increased health outcomes, better preventative care, better patient outcomes, while bending that cost curve for us across a number of places. But we also recognize that rural providers, both hospitals, OBGYN, rural dentists, may not have the same exposure or skill set or even infrastructure within their office to be successful in value-based programs. And so one of the areas that we were very excited about to invest in through the Rural Health Transformation Fund is supporting the rural providers in those 3 areas: rural hospitals, rural dental providers, and rural OBGYN and family medicine doctors serving our maternal and child populations, getting them the resources that they need, the supports, the opportunities to be creative within their practice to drive value-based payment efforts. As part of that, we have 2 positions that are coming to TennCare. One is honestly just for the project management. The Rural Health Transformation Program, as you have seen from the federal side, has a significant amount of reporting requirements, application requirements. It's a fast turnaround time. And so just that project support needed to meet the requirements in order to maximize the funding that we can have is one position. And then the second position is focused on data. We know that for any successful value-based payment program, you need to be able to provide timely, transparent, and accurate data to show health outcomes, to show opportunities for care gap closure. And so a data analyst is added for the TennCare team as well to be able to tackle the 3 specific value-based payment programs that we're trying to stand up during this time period.
Okay. Director, just to go back on Chairman questions earlier regarding TennCare growth rates. You stated that the TennCare growth rates over the last 5 or maybe 10 years was around 3.8%, whereas the national trend was around 1.6%. Of course, it's always good to compare ourselves to other states to see what they're doing. And of course, in that area, we're doing that. But when we compare ourselves, particularly in the last 5 years, the inflation rate in the states have been astronomical. I guess the question would be, if we compared ourselves to ourselves, could you tell us what the growth rate has been for provider payments by percentage over the last 10 years? Have we increased payments? When I talk to primary care providers in my district, they seem to believe that the reimbursement rates for TennCare have not grown at all since 2001, to the point where primary care physicians, particularly in my district, are saying, I'm not going to see TennCare patients anymore because I'm not making money anymore. The promise of practicing medicine isn't what it once were. So I guess my question to sum up would be, if you compare us to ourselves, have we really had an increase in our provider reimbursement rates, or has it all been inflationary?
No, we certainly have had an increase. So when it was specifically the last 5 years at an average of 3.5% if we're looking at physicians. And that represents year over year actual increases. And that was the comparison to the national of 1.9. And then we looked back, let's look at the last 8 years because we're looking at, the administration. And then that was, we actually had doubled the national average. And then, the other thing I would point out is if we look beyond just the increases through our managed care operations, we've added more than $5 billion on top of that over these last 7 years, which is that just dwarfs anything that we've ever seen in this state. That's almost $3 billion for hospitals, $700 million for nursing homes, and so I would put Tennessee up there with any other state in terms of what we've been able to do for providers over these last 7 years. Now, does that mean that we don't have challenges? No, we certainly have challenges, but every state in the country, every Medicaid program, they're having these same types of debates, regardless of what they pay. So you could take the highest paying Medicaid state in the country. When I talk to my colleagues, they're having the same challenges and debates that we're having. And that's understandable because Medicaid it's really not designed to pay what commercial pays or even what Medicare pays. And so that's just, I think we're always going to have those kinds of discussions and debates, but I do feel when you consider all the responsibilities that we have to the state and to our taxpayers and how much other investments in other areas, other departments depend on what we do at TennCare, I feel like we're doing, we've done a really good job. It's not perfect, certainly not perfect.
For sure. I tend to agree with you. I just, with the reductions we're going to see in the next several years from the federal government for the pressure that providers are feeling at home, our concerns about them seeing TennCare patients and what an adequacy problem might look like. My concern is that if 2028 rolls around and we haven't really taken a hard look at what our provider reimbursements are, we may be in a place where we have 1.2 million people who have difficulty finding a physician at any rate at that point. And so I'm a little bit concerned because I do think with the federal reductions in 28, the hospital assessment will gradually phase out. The value of it will gradually phase out in the same way it phased in from 2% to 6% now. And so I'm a little bit concerned, and we do that, and maybe we should take a hard look. I mean, we talk about collaboration and cooperation, and we do have that. There's no question about it. But when we look at $1.4 billion in shared savings at the end of the year, at the end of this fiscal year, we also get a table in the budget A34 that tells us where those monies are going to be spent. And this legislature is simply giving a up-down vote on it with very little input. And so I know there's some things in there that you're really excited about that you and I have shared about, but I do think that the time may be approaching where we look and say, well, maybe we should pay our providers more and not have $300 million in shared savings. Maybe we have $100 million in shared savings so that we can invest in these other programs and really take care of the first priority first. And so hopefully we can continue to have those discussions, but I am acutely aware, unfortunately, it keeps me up at night about what we're going to be doing in the next couple of years and how we're going to be able to provide healthcare services to our citizens. And so I look forward to working with you, but I do think it's even though we're doing a great job, I think there is a time in the future where it's going to be much more difficult to make change than it is now.
Yeah, I appreciate those comments. And, I do think it's important to note that the stability and the success that we have here in Tennessee, it really is not normal. It like I said before, it's a very difficult time in Medicaid. And if you look across the country at what's taking place right now, you're seeing states that are doing across the board provider cuts, and they're also cutting services. And that's not happening here. And the reason why it's not happening here, and we don't anticipate that happening here, is because we've all done the work together to get us to the place where we are.
Well, thank you. Thank you so much for your work. Chairman Hicks, I do have some guests in the audience I'd like to introduce. At the very back, you'll see occupational therapist from my district, Miss Heidi Clopton and her team with the Vision Center there in Cookeville. Her husband, Dr. Clopton, is an optometrist there. And so I got to meet this morning with them and one of the patients that is in my district, and appreciate the hard work that you guys do in the Upper Cumberland. So welcome. Thank you.
Welcome, and let's go to Representative Gann. I think he also has a personal order. Representative Gann, you're recognized.
Thank you, Mr. Chairman. I've got two good friends of mine with me today that are two of the best independent insurance agency owners in this state. And Lou Moran from Knoxville and Chris Allison from Jackson. If y'all will stand and let us welcome you guys. And Mr. Chairman, I think there is the Millington leadership class still here? If y'all will stand and let us, I know that Chris Thomas, I think he stepped out, but welcome to our meeting. Thank you, Mr. Chairman.
All right, thank you. And again, we'd like to say welcome to everyone. All right, let's go to Chairman Vaughn. Chairman Vaughn, you're recognized.
Good morning, folks, and thank you for being here. Y'all are going to have to forgive me a little bit because there's been about 10 minutes since you discussed shared savings, so I'm going to have to ask you some other questions about that. But in the meantime, I want to pass along a compliment. I have a constituent who has a special needs daughter that was on private pay insurance for most of her life, and they struggled mightily to get her taken care of, but she aged out and went on the TennCare rolls. And I got a text from her parents. And it says, by the way, this is good. I just want to tell you that this month's experience with TennCare has been outstanding. Our order was put in, everything came on time. We made 0 phone calls, no delays, no dramas whatsoever. We've been doing this for 3 years. And that's with my office assisting, trying to get them medicine on time. This is month 3 on straight TennCare. This is the first time in 3 years that the process has worked smoothly for us. So congratulations.
Thank you. Thank you.
And that's the Grover family from Germantown, Tennessee. All right, so shared savings. It's up to what, 1.3 billion? Is that a fair amount that we've received?
Yes, sir.
And I know my colleague talked about what are we going to do with those shared savings? What can we do? How much of that money has been fully expended?
Okay, let's see. I've got that.
And in a follow-up on that, if while you're looking, Mr. Chairman, if I may, what are the spending limitations of that, and what's off limits to spend it on?
Okay, so if you go back to the first year that we had shared savings, that was fiscal year 23. And since that time, so this will be our 4th year of shared savings. Since that time, what we've done is we've brought a plan as part of our budget, and then we've essentially obligated or formalized a plan for those funds over the course of several years. And so if you look in the budget book on page A35, you can see that entire spending plan for each year of shared savings. So it's important to note that when we propose for example, for fiscal year 23, when we proposed that budget plan, it wasn't all expended in fiscal year 23. It actually spreads out all the way to fiscal year 31. So when you look at our shared savings, of course, we just got the $300+ plus million for year 4, and that's what we're discussing now. So that hasn't actually yet been approved. So you're looking at about $1 billion. We have spent $180 million. There are $344 million that are on track to be spent in this current fiscal year. Now, in terms of what we can and can't spend that money on, what we committed to do with the shared savings dollars, we committed to reinvest those funds back into the TennCare program or in ways that would benefit the members that we serve. So, for example, last year, we were able to utilize $100 million for the victims and the communities impacted by Hurricane Helene. And the thought process there was, well, that was going to be for zero interest loans to help with water treatment and debris removal. And we thought that was very defensible because we had a large percentage of TennCare members in those communities. And what's more important to health than water and being able to access care? So that maybe gives you a sense of, does it have to be directly related to TennCare in terms of, does it have to stay in TennCare? Not necessarily. We were able to take those dollars and give them to TEMA, and then TEMA did the zero interest loans with those communities. But we were able to do that because it did impact the health and welfare of the people that we serve.
Mr. Chairman, but it could be used if we wanted to increase reimbursement rates. It would be eligible for that if we decided to make that policy decision. There's no prohibition against
There's not
it.
a prohibition, but what I would say there would have to be very, very cautious. And we haven't done this, but ultimately it is your decision. We have not used, because these are non-recurring dollars, so we have not used non-recurring dollars for recurring expenses.
Good
And so
point.
that's why we have not put those into rates.
Good point. Switching gears just a bit, Mr. Chairman. I know you've put some into maternal health. Are we seeing the needle move with regards to outcomes when it comes to mortality rates within the maternal setting, either from mothers or children?
Yeah. I think I'm going to defer to Dr. Wu on that. I know we're very hopeful that we're going to see improved results there. The data kind of lags. We've made some good policy decisions. 12 months postpartum is one of those, but Victor, why don't you jump in on there?
Thanks for the question. It is an area where I know many members of this committee care deeply about maternal and child health, and certainly we do as well at TennCare. We have begun to see some promising results, but I think what I would first want to frame is that we know that maternal and child health is not just a TennCare issue, although we have a significant role to play. It is a complex challenge that faces our entire country and certainly within our state. We do know that our maternal mortality rates in Tennessee are toward the bottom of the country, and we're tackling that very deliberately. The changes that we've invested in, including the postpartum extension, including increasing access and supporting providers, have begun to show some early signs. We've actually, for example, seen the lowest rate of neonatal absence syndrome births that we've ever experienced in the last decade, this last year in Tennessee. We've also seen our postpartum visit rate increasing as well. On the other hand, we still know that our maternal mortality rates, one death is too many in the state, as well as some of our preterm birth rates are opportunities for growth and improvement. So still a lot more to do. We do think we've seen some early promises, but certainly looking for any partner that we can work with to figure out how to tackle that and solve a complex problem for the state.
All right, thank you. We look forward to seeing that data as it continues to roll in. And Mr. Chairman, my final question is, out of the value-based payment, I think it's $10 million. Did any of that money make it to rural hospitals, and if so, how much?
So those dollars are for the evaluation of our existing value-based payment programs and the improvement of those programs, and then the design of what we hope will be will be a new value-based payment model. So those dollars they haven't gone out to providers, but the hope is that once we develop and design and actually improve our existing programs and then design and implement a new program, that is going to result, that's the whole point, it's going to result in a new way to pay our providers and to pay for quality versus simply volume.
I will add as well, though, that is an area of our focus for the rural health transformation funds, that there are direct dollars targeted for rural hospitals as part of value-based payment in our application.
Roger that. Thanks so much. Mr. Chairman, I'm going to give it up to somebody else. I appreciate your indulgence.
All right, thank you. And members, we do have 11 more people on the list, so we will get to everyone. And I just want to make sure everybody understands, just ask your question, and then for our presenters, just answer the question and let's move. We're going to get to everybody. So, all right, let's go to Chairman Hicks. Chairman Hicks, Washington, you're recognized.
Thank you, Mr. Chairman. Thank you, Director, for being here. On or before January 1st of 2025, we established a buy-in program for the Working Individuals with Disabilities Act. This enables them to access health insurance coverage through the Medicare Assistance Program. Can you provide an update on the program, and has CMS given final approval for that program, and is it operational?
Representative, I wish I could tell you it is operational. We are still waiting for CMS to give us approval on that. And I share your frustration with the delay, but we still do not have approval. And we have communicated with CMS on several occasions, and they have not been able to give us a definitive date on when we can expect that approval. I'm not worried about CMS rejecting that. Other states have it, and so I feel like we are going to get approved. But unfortunately, we work under their timeline, and they don't work under ours. Now, in their defense, we did spend a lot of time last year focused on the hospital reimbursement, the directed payment that we were just talking about, the large amount of money going to hospitals. And I do think that took up a lot of the bandwidth. But now that is done, we're hopeful that they will get to this very quickly.
Okay, thank you, Mr. Chairman. And I'm assuming that, has anyone enrolled for this program up to date, or?
No, sir, we really can't. We can't get started until we get that approval.
Okay, and the fiscal note estimated that 9 positions would be needed to execute this program. Have those positions been filled?
No, we have not. We have not filled those positions. We can do that quickly once we get the approval, but we really don't have the authority to expend the funds until we get that approval.
The legislators also stated that TennCare should use shared savings to the extent permitted. So are shared savings being utilized in this program? Can that get the program started? And is there anything that would prevent shared savings from being used in this program?
Well, the way it's been a while since that passed, but the way I remember that is we were actually allocated dollars outside of shared savings for that purpose, and so we haven't had any shared savings allocated or appropriated for that program, and we don't need those dollars. I don't think it'd be appropriate to use shared savings for this because, again, these are recurring expenses, and so, for example, if we started using shared savings for this and ultimately, for whatever reason, we did not get CMS approval, we'd be in a really bad spot. We'd have to actually end the program, and that's the last thing we'd want to do.
Okay, Mr. Chairman, I got just a couple more questions.
Yes, sir,
please.
you're recognized.
What is the TennCare per member per month premium paid to MCOs for TennCare participants? And in that PMPM premium, is it the same for all MCOs?
It's going to be dependent upon the particular category of individual. So for example, we have someone in long-term services and supports, for example, is going to cost more than, say, a child. And so there are different PMPMs based on the category, but I'll let Zane give some more detail on that.
Correct. So we pay all different PMPMs based on demographic cohorts. I will tell you the weighted average, which may not mean a lot since we have very different types of people on the program. The weighted average is about $520 $22 a month per person. That also includes our most expensive people and then our lower cost people as well. The MCOs largely get paid the same amount. There is a process called risk adjustment where through luck of the draw, if one MCO happens to have a more sick or more acute population, those capitation rates are adjusted on a budget neutral basis. So largely the same rates, but with a little bit of differentiation for risk adjustment.
And what percentage of TennCare's PMPM revenue is spent on that care?
It's a great question. So we have a minimum MLR medical loss ratio of 85%, which means our MCOs are contractually required to spend at least 85% of that money. Otherwise, we would recoup back from them. Typically, they're going to run in the 88 to 89% range, which leaves them enough to cover, usually about a 10% administrative overhead.
Okay. Thank you. And thank you for answering those questions. Thank you, Mr. Chairman.
Thank you. Next on the list, Chairman Baum. You're recognized.
Thank you, Chairman Hicks. It's possible for an MCO and providers to reach an impasse in their negotiations over reimbursement rates because that's exactly what's happened in Murfreesboro. United Healthcare and Murfreesboro Medical Clinic have reached an impasse and the clinic is no longer taking TennCare patients. And so I guess my first question to you is, are you monitoring whether providers are still taking patients, TennCare patients? And are you monitoring whether the patients have a provider somewhere?
Yes, absolutely. We do monitor that. We do hold our MCOs accountable to that. And so, for example, in the situation you just mentioned, United is responsible for ensuring that the members that were utilizing services at that particular provider have a place to go. And that is a requirement on the part of the MCO to provide that information to us.
Okay, and last question, you've advised us not to use the shared savings dollars for reimbursement rates because the reimbursement rates would be recurring. And I understand that's good advice. We're using some of our shared savings for things like dental care and maternal care. Are those recurring expenses?
Those are not recurring expenses. Now, I will give a caveat. So for year one shared savings, that was the Strong Families Initiative. So we actually did add some people. We were serving more children, more pregnant women. We did the postpartum, 12-month postpartum coverage. Those are recurring expenses. But if you'll recall, we actually received approval for recurring dollars for that. And then we're buying them back with non-recurring shared savings dollars through fiscal year 31. So that prevents the fiscal cliff. So we were very intentional and careful to make sure that we're not actually spending the shared savings dollars on recurring expenses. Other than that year one model, though, we didn't get recurring dollars in the budget, and then we're buying back.
Okay.
Well, there's another example. No, that was non-recurring. We brought some people off of the waiting list for ECF, but through attrition, we're going to avoid a fiscal cliff for that.
Okay, thank you.
All right. Thank you. Next on the list, Chairman Hale. You're recognized.
Thank you, Chairman. Director, good to see your staff. I want to give a shout out to Miss Ashley. She was even available last night at almost 7 o'clock to take a call for a constituent issue. So appreciate your team. First of all, when we talk about rates, and we've talked about physicians and doctors, but I also want to mention, and I know, Chairman, you've dealt with this issue as well, with ambulance reimbursement rates. They're in the 65%-ish rate right now, I think, and moving that up to that 110%. So can you kind of tell us, I mean, we talk about physicians, we talk about hospitals and stuff, but they're vital to every one of our communities. And so can you kind of hit on that just a second?
Sure. So for EMS, there's actually a statute that speaks to what we will pay as a percentage of Medicare. And I think that's the 67% that you were referring to. But they also have an assessment, much like the hospitals and the nursing homes, where they pay on top that results in higher payments on top of the 67%. And the reality is, you take those things combined, it's actually more than the 110% of Medicare, which means beginning in 2028, we're actually going to have to reduce those payments.
Okay, all right. If I could, real quick, another thing, we're talking about these reimbursement rates for doctors and stuff. So can we look at, we've done it for nursing homes, we've done it for hospitals. Can we look at these providers and take some of those shared saving dollars and do as an award, a grant, or just a supplement, it'd be a one-time thing, but just to say, as a thank you for taking care of our people, it's not recurring, it's not, is there not something we can do like that we've done for nursing homes, we've done for hospitals?
It is possible. Now the difference, with nursing homes and hospitals, they do have an assessment. So in terms of, we've been able to do some things working with those groups because they do have a provider assessment, whereas that's really not feasible for physicians as a whole. But you potentially could do some things one time with shared savings dollars. It's really just about, now you'd have to make some decisions about, you don't want to do this, and so you do this instead. Last year you all did take some shared savings dollars and you gave it to hospitals.
Mm-hmm.
So it has happened.
Right, and that's what I was saying. So last two things. First of all, I do want to commend y'all on, we had some vendor issues and stuff. I'm thankful, and most of those were with children and stuff, diapers and different things that we were having. So thank you. And then to the pathway to independence, we had a testimony given in, or a presentation given in health or in insurance a couple of weeks ago. And one of the things Empire Upper Cumberland stressed was many of these people are, when they're looking at getting pay raises, when they're looking at certain things, and it's going to cause them to drop off TennCare. And to have this pilot program is huge. And so I'm thankful for that. Was glad to sit in the office and discuss that. So thank you for the work on that. And I definitely look forward to supporting that. And thank you so much. Chairman, thank you.
All right, thank you. Next on the list, Representative Freeman, you're recognized.
Thank you, Chairman. I have some questions about shared savings. No, I'm kidding. Listen, we all know that at the end of 25, the Trump administration let the enhanced subsidies expire, leaving 20 plus million Americans, hundreds of thousands of Tennesseans with, unaffordable health care. Premiums more than doubled. Have we seen an increase in TennCare rolls because of this? And if not, where are these people getting their insurance now? Are they utilizing emergency rooms, or what are we seeing?
Well, so we have not seen an increase in our TennCare rolls. We're actually kind of where we were pre-pandemic, which is what we expected. And that's not surprising. We're a non-expansion state, and so when you think about the individuals that are that would be going on the insurance exchange, those are not the members or the individuals that would qualify for TennCare for the most part. So I can only speak to the Medicaid side. I can't really speak to the private or the marketplace.
Representative Freeman. Good. Chairman Boyd.
Thank you, Mr. Chairman. Director, it's great to see you today. Quick question. So does the budget include any funding for the hospital cut buybacks that are covered by the assessment? I think in the past, we've had some money in the budget for that.
Yeah, it does not.
Okay. All right. Thank you.
All right, thank you. Next on the list, Representative Reeves, you're recognized.
Thank you, Mr. Chair, and thank you guys for coming again today. And I'm just going to kind of ask a question that builds on a question I asked last October when you guys came. And every year, you guys contribute to the Diabetes Action Report that gets released every 2 years. And in that report, under the state group insurance plan, they note that if just 10% of their members actually develop diabetes, that it will cost the state an additional $142 million a year for care. And so my question is, under TennCare, you guys cover approximately 5 times as many as is in our state plan. Have you modeled what a comparable increase in diabetes prevalence would be under TennCare and what the economic impact would be to the budget?
I don't think that we have modeled that, but certainly there would be a very large impact, like no doubt. But I don't know, Victor.
We haven't modeled that specific question, but certainly we recognize the value of prevention, and all of our health plans do have wellness programs, counseling, nutrition access, and we try to support our members, in that pre-diabetic range or those with early diabetes with supports both from a pharmacologic perspective, but also from a treatment plan and prevention and nutrition world to get them access to resources. But we've not modeled the specific financial cost to that.
Mr. Chair, with your indulgence, I would just encourage you guys to try to do that so that we can see that in the next Diabetes Action report, because I think that's going to be an increasingly a big problem. I mean, it's a growing problem in the population across the U.S. and certainly in Tennessee. So thank you very much.
All right, thank you. Next on the list, Representative Miller. You recognize.
Thank you, Mr. Chairman and Director. Thank you and your team. Looking at slide 2, it brings back memories where you started in 1994 when Governor Ned Ray, Mike worked along with the Tennessee General Assembly, implemented, created TennCare, and there were a number of naysayers saying this thing will never work. And here we are today. And so I'd like to thank you all for that. But going to slide 11, for me, whenever, I look at this chart, and well, actually it's 13. And I guess words are worth 1,000, and the number of people that started in January 2020 as opposed to today. And I look at that drop off, and I think the question may have been asked, what has happened to these individuals? Because I see them as Tennessee citizens. Where are they now?
Yeah. Well, I can't answer that for every single person. I can tell you the reason why you see such a sharp increase and then a sharp drop is because during the pandemic, we were prohibited from removing anyone from the rolls, whether they were eligible or not eligible. And so we fully expected that we were going to have a spike and then we were going to have a decrease. And we also projected that when it was all said and done, we would be back to where we were pre-pandemic. So this is exactly what we had expected to see. I also can tell you that when we looked at the individuals that came off of TennCare during their redetermination, I believe there were, I want to say 40% that had other insurance, which was surprising to me, but it also, maybe it shouldn't be surprising because if someone has other insurance, it probably means that they're not eligible for TennCare. But I can't, there's no way for me to tell you exactly, this person lost TennCare and so now this person is, enrolled in employer sponsor plan or the marketplace. We don't have a state-based exchange, and so I can't. We're not able to track. We're not able to track that.
And that was going to be my follow-up question. There's no way for you to track that, even if an individual who was once on TennCare, they were disenrolled or they lost it for some reason. Did that individual not try to communicate with TennCare to at least appeal to say, why am I disenrolled? Do you all have a way of tracking those, I guess you would say, complaints or disagreements?
Well, we certainly we have an appeals process, and we do get a lot of appeals, and so we have that information. But ultimately, what it really comes down to is, do they meet the requirements under the law for eligibility or not? And if they don't, then we are, we're prohibited from enrolling them.
Again, that is a tremendous drop of individuals that, for whatever reason, are no longer on TennCare. And this whole idea and concept behind TennCare was to provide health care to our Tennessee citizens. And again, they say pictures are worth 1,000 words, but if you look at this chart, it's worth 1,000 people, of individuals that we as a state cannot account for. And I think we should be able to at least account for them, each and every one of them, if we possibly can. Thank you, Mr. Chairman.
Thank you. Next on the list, let's go to Leader Camper. Leader Camper, you're recognized.
Thank you, Mr. Chairman. I want to go back to the money we spent on Helene, the 100 million. I know they were reimbursable loans. And I'm sure there was terms and conditions on the loans when they would be repaid. We wouldn't want to put pressure and stress on those counties because it's just been a lot. So when are they expected to begin to repay the loans back to TennCare?
I don't have an answer on that. Part of it depends on when the dollars from the federal government come in to those communities. TEMA will handle that for us. And then ultimately, once those are collected, those dollars will come back to TennCare.
Okay, that was my question, Mr. Chairman. Thank you for your answer. Appreciate it.
All right. Thank you very much. Next on the list, Representative Parkinson, you're recognized.
Thank you, Mr. Chairman, and thank you all for everything you do. I want to go back to the shared savings, of course. In regards to shared savings, are we seeing a pattern developing in regards to the amount of revenue that's coming back from this strategy? And basically looks like fiscal year 23 was it 330 million. 24, 334 million, 25, 377 million. Am I correct in?
Yes. So it's been over 300 million every year. The year where it was the largest, that was because we had the enhanced federal match, which actually drove up the shared savings amount. So that's why you saw a little spike that year.
And so may I continue, Mr. Chair?
Yes, sir.
Okay. And with that being said, if we're seeing a pattern of let's say an average of 300 million that is coming in every year, although I know we don't want to use non-recurring funds for recurring items, but couldn't we look at the pattern of the amount of, somewhere around $300 million. It looks like that's kind of in the space that we're in each year, to be able to either adjust the rates or to be able to add individuals to safely, to our roles to be able to utilize some of this money for that.
Well, this is just my opinion. I would say no. That would not be conservative because this waiver ends in 2030, and there's no guarantee that we're going to have that the next waiver will give us this same benefit. We're very hopeful that it will, but we are the only state in the country that has something like this, and I think I'm very hopeful that we can prove that it's been very successful. And I fully believe that the federal government needs to incentivize states to be efficient. If the only way that a state can get more Medicaid dollars is to spend more money, that's a failing system. And so our model kind of reverses that. But there are no guarantees. And so I would, in my opinion, we would not want to use those dollars for recurring rate increases because ultimately when we get past 2030, we'd have to cut those rates.
Just last question, Mr. Chairman.
Yes, sir. You're recognized.
And thank you for that. And with that being said, are we simply looking at year to year to decide how we're going to spend these dollars and how does how does that jive with, the members of the General Assembly, either having an input or giving direction in how these dollars are spent? Is it based on what you guys propose and we just basically say yes or no, or should there be another strategy to where, some of the members of the General Assembly are helping you guys, giving you guys direction on how this money is being spent? Because right now, based on what you're saying, unless I'm wrong, there doesn't seem to be a methodology or a strategy for this, specifically for this 300 million. It's almost kind of, well, we decided we're going to spend it for this, we'll do it for this. If we decide we're going to spend it for that, we'll do it for that. So
Yeah. Well, it is year to year because we never want to spend dollars before we have the dollars. And even though we've been pretty consistent and we've been able to achieve more than 300 every single year, it's not a guarantee. It really is going to be dependent upon what we spend in any given year versus what's called our budget neutrality cap is. In terms of how the process works, we bring these items just like we do any other budget item. And ultimately, it's the General Assembly that decides how we're going to spend those dollars. We propose, and then you all decide.
All right. Thank you. Thank you, Mr. Chair.
All right, thank you. I have no one else on the list, so I want to say thank you to TennCare this morning for presenting. We appreciate your participation in this. Thank you very much. All right, let's move right on to Department of Human Services and Commissioner Carter. That's good. Commissioner, good morning. Welcome you and your team. Before we do get started, let me go to Chairman Halsey. Chairman Halsey, you're recognized.
Thank you. My timing is probably all wrong. We had another prison guard murdered last night at Morgan Penitentiary, and I just want to ask folks who are watching and folks in this room to please pray for that family, and also as a legislature, we've got to work at finding ways to stop this kind of stuff.
Thank you, Chairman. Good word. Do remember the Pettigo family this morning. All right. Without further ado, Commissioner, thank you for being here. We're running a little bit behind, so I want to say thank you for your patience. And without that, if you'll just begin by introducing yourself and who you have with you. Just a reminder that we do control the microphones up here, so once you see the red light come on, you'll be ready to go. So, Commissioner Carter, thank you.
Mr. Chairman and members of the committee, thanks so much for this opportunity. My name is Clarence H. Carter, and I am the Commissioner of the Tennessee Department of Human Services. And I'm joined by my Deputy Commissioner and Chief of Staff, Whitney Page, Deputy Commissioner of Operations, Melissa Cobb, Deputy Commissioner and General Counsel, Chris Ann Hodges, and Deputy Commissioner of Programs, Sherelle Campbell Street. I wanted to share with you that I am blessed to be supported by an outstanding senior leadership team that guides a dedicated and passionate staff of over 3,000 folks that serve more than 2 million Tennesseans each year with distinction. I want to be respectful of your time for questions, but there are just a couple of things that I'd like to share with you before we dive into our budget asks. The first is we are at a historic and unique time in the American Human Services system. You will see in our budget presentation, there is a movement to shift costs for operating the human services system from the federal government to the states. And that presents not only opportunity, but significant challenges. And we are doing everything we can to prepare for those challenges and position Tennessee in the best light. But I do want to share with you that it is a unique and challenging moment. The other thing that I'd like to share is I'm pleased to report that much of what we have seen from a national perspective in human services with some massive issues of fraud, waste, and abuse. I'm pleased to report that the structures that are in place in Tennessee, along with the diligence of our labor force, enable us to stay in front of those issues. And I'm not going to suggest for a minute that there is none of that in Tennessee. But what you have seen in other places, it's not visited here, again, because of the structures that Tennessee puts in place and the diligence of our labor force. Okay. And so with that, I'd like to get into our budget. The first is, and I mentioned these changes in the human services system, and this is where it begins. Our first ask before you today is for the cost share of administering our supplemental nutrition assistance program. Up until now, the administration of the SNAP program has been a 50-50 cost share between the federal government and state government. And that simply means the cost of our operating the program, we have shared 50-50 with the federal government. But HR 1, the One Big Beautiful Bill, proposes a cost shift that would have the state pay 75% of the administrative cost and the federal government 25%. Okay. The cost of that to the state is $58,334,700 for 9 months. And so that is our first ask. It is for that 75%, 9 months of the 75% of the administrative costs of the SNAP program. Our second ask is the statutory salary step raises of $179,700 state dollars to be matched with $348,800 federal dollars to meet the statutory salary step raises for district attorney generals, totaling $529,500. Next is a non-recurring grant to the statewide alliance of the YMCAs for $15 million. And finally, the last is a recurring grant to the YMCA Community Action Project program for $250,000. There are 3 supplemental requests that we have. The first is the summer nutrition program. Last year, the department distributed $120 payments to eligible children in counties that were unserved or underserved by our summer food program. We are asking to continue that program this year and ensure that no child goes hungry in Tennessee. The total ask is $3 million. And I would just share with the committee, there has been an appreciable hue and cry for Tennessee to adopt an additional federal summer feeding program. Okay? And I would share with you that with what we already do through our summer nutrition program and the additional $3 million from last year, we ensure that we make healthy and nutritious foods available throughout the summer when students don't have access to free and reduced lunches in school. And then the next request, supplemental request, is the summer food assistance. As this administration has made a concerted effort in increasing the number of summer food sites across the state, we also want to support those organizations who've signed up to be sponsors. With the $5 million in this request, we look forward to assisting sponsors in the summer 2026 summer food program with costs that fall outside of the reimbursable cost of the federal program. And finally, for supplemental request, this is a data analysis contract. The department is seeking $8 million for a data governance project to help us address our SNAP error rate. In addition to the administrative cost shifts discussed earlier, HR 1 will also shift in the next federal fiscal year how benefit costs are split. And let me just say that, again, this is a part of that historic change in the way the Supplemental Nutrition Assistance Program is operated. Okay? Heretofore, the federal government has paid 100% of the benefit. We split the cost of the administration, but 100% of the benefit has been paid by the federal government. Again, HR 1, the One Big Beautiful Bill, proposes shifting costs based on a state's error rate. And the error rate, okay, is either, it's a combination of underpayments or overpayments to the consumers that receive the SNAP program, okay? And so over the course of the last year and a half, as we've converted to a new system, we've been able to reduce our error rate to more than 10 points to under 10%. Our last year's error rate was 9.47%. But for any state that has an error rate in excess of 6%, there will then be a shifting of payment on the benefit from the federal government to the state. And there's a tiered amount for that shift. And so we are working diligently to get our error rate to that 6% so that there is no additional cost to Tennessee. I will tell you that is, we are pushing a boulder up a hill, but we are working very diligently to do it. I just want to make sure that we don't understate the very significant challenge of this sort of historic cost shift of the federal government to the states. And so this data analysis, this $8 million request, is just one part of a very comprehensive approach to our addressing the issues attendant to our error rate, if you would. And finally, we've got some reductions. we want to reduce cost in budget and will continue to evaluate each year. Our first reduction is $2,333,500 in administrative operations. For example, we've significantly cut our mailing cost by working with the Department of General Services and changing the envelope size in which we transmit information to our consumers. And additionally, we've negotiated with our vendor regarding our call center agents for one DHS and have saved taxpayers $3 million without sacrificing service to our customers. With that, Mr. Chairman and members of the committee, that is our budget presentation. Prepared to address any questions or challenges and comments you may have.
All right, Commissioner, thank you very much. Thank you for your presentation. And we will begin with Chairman Hawk for a line of questioning.
Thank you, Mr. Chairman. Commissioner, your team, we've experienced the TANF conversations since you started your work here in Tennessee. We worked very closely the whole time you've been here, and I want to thank you for your work. I appreciate that. What I'm hearing in your presentation is our obligation, both administratively and legislatively, to be good stewards of taxpayer dollars. And as we seek fraud, waste, and abuse within the systems that we have, it's our role to ensure that the right people are being assisted, and that if you're gaming the system, we need to find you out. The goal to get toward the error rate of 6% is admirable, and thank you. Engage us on how we can help. We want to be part of the solution. Whatever we can do, we want to be part of that. I find it interesting, and I'm a small business owner myself, and going as far as getting a smaller envelope because it's less costly to get the information out. It's a small thing, but those details matter, and I appreciate that. I want to go to the SNAP program in particular, and you spent a lot of time talking about that, the shift of that $58 million in administrative costs that we're going to bear the burden of now for 9 months, I believe you said. Is that a recurring revenue stream? Is that something we're going to expect? If it's 9 months, $58 million, and it gets to the $70 million over 12 months, I'll envision that. Tell me, is that, again, is that recurring? And are there any stipulations that could change that in the future, sir?
Representative Hawk, that will be an ongoing expense. And any changes in that would have to be, again, federal legislation, because this is now part of it's federal legislation that sets out this cost share. And so that will be a consistent number unless there is other action at the federal level to change that to 75%.
Chairman Hall.
Thank you, Mr. Chairman. And I know as we've had those TANF discussions over the years, there are stipulations and percentages on administrative fee to grant recipients in other areas. We'll go outside SNAP. We'll go into the other areas, TANF and other areas as well. Are there new restrictions on administrative costs that can be part of other DHS programs? That's a broad question, but largely, are we going to see caps on administrative costs that go out to our partners in the communities?
At this time, you are seeing what we have, what the federal government has laid out as the new relationship on the administration of probably the most significant program that we operate. Significant from the standpoint of size, okay, dollars and cents wise. My suspicion is that there will be more down the road, but this is what we have to address at this point in time.
All right. Thank you, Chairman.
Oh, and I'm sorry, Mr. Chairman, if I could just also take this moment to thank Representative Hawk for all of your help in helping us set up and administer our TANF Opportunity Act. That has done some groundbreaking work for Tennessee. And I just appreciate your leadership in that regard.
All
Thank you,
right.
Mr. Chairman.
Thank you. The next thing, I've got a couple questions regarding the SNAP ban pilot. Of course, we passed legislation that would allow, beginning in January or July 31st of this year, Tennessee, the state will begin a 2-year pilot program which will ban the use of SNAP benefits to purchase certain high sugar or processed foods and beverages. And so to see if the ban works, the state will conduct surveys and dietary studies. And then, of course, recipients can opt out of these surveys without any penalties to benefits. So has there been any issues with implementation so far? And Commissioner, I'm going to bail you out. You forgot to mention that lady to your right, Miss Callan Schmidt Baguette. And as much as I call her on the phone with my constituents, I'm going to give you the opportunity to do so that you don't get kicked under the table there.
Thank you, Chairman. I do tend to make my presence known pretty quickly. Callan Baggett, and we have received approval from USDA to implement what we call our Healthy SNAP waiver. It will go live on July 31st of this year. We have been having pretty much biweekly calls with USDA throughout the fall, FNS with both the regional office and folks in the Secretary's office to work on that implementation. We've had really good feedback from the Retail Association, the Grocers Association, and the Fuel and Convenience Store Association, who've helped provide impact statements and suggestions of how we can make this rollout as smooth as possible. So we're excited to keep y'all updated.
So how many of the surveys that you'll send out, what's going to be the data point where you will feel like you're getting good data? What percentage of participants?
We're still working on our evaluation plan that's required as part of the pilot. So we have a great team in-house, the Data Strategies Unit, that can help us. We've additionally had some conversations with higher ed institutions. I will make the plug now that if there are any grad students who want to do some free work, give me a call. My email is on the website, and we'd love to talk to you. But we do plan to, as we do not have any additional dollars to support this pilot, we do plan to try to keep those costs low on implementation. So as we develop that evaluation plan, I can follow back up with you.
So no plans to incentivize participants right now? Okay. All right. Thank you. Let's go to Chairman Gillespie next. Chairman Gillespie, you're recognized.
Thank you, Mr. Chair. Commissioner, thank you so much, and team, for being here. In this proposed budget, you've included $15 million for a grant to the statewide alliance for YMCAs. And another $250,000 recurring for the Community Action Project program grants. Got a couple questions on that. First, what will the statewide alliance be using the grant for, if you know?
Thank you, Chairman. So we received some information. This was a direct appropriation grant given to us by the governor's office. We've received some information from their conversations. It is their day on the Hill today, so I know that they will be coming to your office and probably talking to you about this. From what we have seen from the one pager, it's a one-time request of $15 million to support out-of-school care and youth development and support child care initiatives.
Got it. And would that just be for Middle Tennessee, or is that statewide?
It is to the statewide alliance.
It is statewide. Okay. And I'm not knocking on YMCA. I'm actually, I do a shameless plug for myself here, participating in the West Tennessee Dancing with the Stars this summer to raise money. So I'm a big believer in everything they do. But moving on, Mr. Chairman, with your permission, just curious, why just YMCA? Because there's so many other service providers that fit this mold, what you just described. And again, I'm not knocking that. I'm just trying to get answers.
This was what was presented to us in the budget from the governor.
Okay. Okay. So in years past, the YMCA was unable to fulfill its commitment for childcare funding that was awarded through ARPA funding in terms of growing its core childcare capacity. Do you think this will help Were you a part of any conversations there?
Yes. So I'll back up a little bit, and there are members on this committee who are part of the Financial Stimulus Accountability Group, FSAG, that awarded the ARPA dollars, and I think that's where there's been some questions. Boys and Girls Club received some dollars, as well as YMCA's, and so we have been in partnership with both of those organizations to expand childcare access in the state. We are happy to report on that information, and FSAG does get updates. We have had some conversations with YMCA's about meeting those deadlines, and so we've had some extra assistants that have come in to help deliver those dollars to the community.
Thank you so much. If you could, the next update, if you could send it to the chairman's office, that'd be great. Thank you. Thank you, Mr. Chair.
Thank you. Next on the list, Chairman Hale. Chairman Hale, you're recognized.
Thank you, Mr. Chairman, Commissioner, and your team, and Ms. Callan out there. Always an honor to work with y'all. First of all, I want to talk about the Child Care Improvement Fund. Over 3 years, a total of $45 million non-recurring was appropriated to a 3-year pilot project to disperse grants to nonprofit and for-profit organizations to establish new or make improvements to existing child care agencies. So first question is, has the entire $45 million been spent? And how many grants were distributed?
Mr. Chairman, thank you for the question. Yes, this is the third year of the Child Care Improvement Fund, and yes, we have distributed all the dollars intended for the 3-year pilot of $15 million a year for 3 years. These dollars were used to help child care providers with salary and capital expenses, which are not covered by the Child Care and Development Fund dollars. Projects included staff retention grants for nonprofits, Head Start child care agencies prior to legislative amendments. And that was $15.5 million in year one. Smoky Mountain Boys and Girls Club direct appropriation of $2 million directed by the General Assembly. And then also new care partnership grant projects to support expansion of child care capacity and to incentivize employer investments. Total awards so far $7.2 million. To the Emory Valley, $3 million. Little Wonders, $400,000. The YMCA of East Tennessee and Hillcrest Healthcare of $700,000. Ballard Health Center, $1 million. More projects are in the final stages in the pipeline in the procurement process. Additionally, we're rolling out a pool of remaining funds to help with capital improvement grants. But the headline is this 3-year fund has been put to significant and appreciable use in building a strong foundation for our Tennessee child care system.
Okay. If I may, Chairman, so how many of those grants were to existing versus new establishments or new agencies? Do you have that information?
Callan, if you would.
So yes, we have, I believe we have 7 or 8 that are to new childcare partnerships, and I can confirm that with you. What we created with the new care partnerships is that it could be a new childcare or it could be an existing childcare partner with an employer in their community, and so that it encouraged sustainability for those partnerships. So I know Little Wonders was new. I think the YMCA was an existing facility, but I'll have to follow up with you on that one. So.
Okay, thank you. And then going along with this, what outcomes have you seen from this program? How many slots have been created? Can you kind of give us a little bit of just a real brief outcomes for the program?
Mr. Chairman, that's other information that we will need to get back to you. We are, I would say, still in, and I realize it's the 3rd year, but we are still in the infancy of the operation of these. So we will chase that information down and get that back to you.
Okay. And if I can, I want to shift gears just a little bit, two separate things here. First of all, I know there was TANF dollars maybe used for some pilots through like the development districts, and then, and I have loved what's happened with Empower Upper Cumberland that the development district has done. So can you kind of give us, honestly, I hate to see any part of that come to an end, or, and there's concern of the dollars for that. So can you kind of hit on that just a second?
Sure. So to refresh the committee, $180 million of the $740 million that had been unexpended in our TANF program upon my arrival. The plan was through the TANF Opportunity Act to use a portion of those dollars to test some initiatives to see where we were going to move to in the TANF program. So we used $180 million of that unexpended balance to fund 7 pilot projects. And Upper Cumberland was one of those. And we have seen powerful results from all 7 of those pilots. We will have a final report. We've done random control trials for all 7 pilots. We will be in a position to have a final report from our evaluation partner, MEF and Associates. We will have that later this year. But I will tell you, our anecdotal evidence across all 7 pilots, we have learned an awful lot. We have grown the capacity of many TANF eligible families, and we will be able to take those learnings and build our new overall approach to TANF post these pilots. We are currently, we will move into a wind down phase. These were 3-year grants, and we are currently moving into a wind down phase in which we have made available $1 million to each of the 7 pilots, which they will use to wind down these activities as we take our learnings and build the next generation of our TANF program. But I would tell you that Upper Cumberland has been one of our standout pilots.
Thank you so much. I appreciate that and the work in cooperation with y'all. So lastly, I want to hit on the summer EBT. When you talk about that and a combination of $8 million there in the budget, first question to that is, how many people, you're talking about the kids, how many kids are served by the program as you're currently looking at?
Do we have a number? Let's see what, please.
Sure. Melissa Cobb, last year we served about 18,200 children with that program.
Okay, so we served 18,000 there, but we can take those dollars and pull down federal dollars, which we do in roads and education, healthcare, and have about 600,000 to 700,000 kids. That's $80 million more that would be coming into our state's economy. That's taking care of more kids. One of the biggest things that I hear from directors of schools when they have to cancel school due to weather-related incidences is the concern of kids not being fed during that time. And so I just think that the more we can do to make sure that we're feeding, and then that's money that's coming into our communities, that's money that's coming into
for jobs and things. So there's a huge range of issues that I have with just 18,000 versus what we could do with a wider program and what we would be able to do.
Mr. Chairman, I very much appreciate your comments. And I'm going to, if you would go outside and come in a little bit. We have, from the federal level of government, 114 programs that were designed to address specifically the issues, the economic, social, and developmental challenges of folks in our society. The federal government alone annually spends about $1.49 trillion on those programs. Okay. My argument is we don't need more programs. We don't need more money. We need to use what we currently have more efficiently. We work diligently within the resources that we currently have to ensure that no child goes hungry in the summer. And I am comfortable that with the resources that this legislature makes available, along with the existing federal resources that we use, that we have the resources to ensure that no child goes hungry. Now, one of the places that we are going to engage this body in, there are places in Tennessee that are underserved, but they are underserved because we don't have delivery sponsors. Because at the end of the day, any organization that wants to help us to be a sponsor to deliver these food benefits, okay, we are happy to make them part of our delivery mechanism. So we are going to be reaching out to you, to members of the legislature, where we see underserved areas. And together, we are going to ask for community sponsors to be able to help in this. So it is not an issue of us not having the resources, okay? The truth is the $3 million that we were appropriated last year, and we did the $120 payments, we didn't expend all of that, okay? So I just make the point that it's not about us not having enough. The aggregate problem with our safety net is the stupid design of it, okay? And how we end up being forced to take all of these individual siloed programs and siphon out precious and administrative dollars that don't end up getting down to the consumers that need them. So I just wanted to sort of share with you our thinking about we are dedicated to feeding children, okay? And we don't want any child to go hungry in Tennessee during the summer, and we think that we have the resources that we need to achieve that objective.
Okay, I appreciate that. I just think that there's more than 18,000 that we need to be looking at. And so I'll end with that. And Mr. Chairman, thank you so much.
Thank you, Chairman Hill. And we do have several folks still on the list. So again, I'll just ask, we're going to get to everybody. I'll just ask, just get to your question, get to your answer so we can move on.
Yes, sir.
Representative Parkinson, you're recognized.
Thank you, Mr. Chair, and thank you, everyone. I wish I had specific questions for each of y'all, but I don't. Well, and so I need a bit more clarification on the error rate and what it affects and how it affects our programming.
So without getting too deep in the weeds, the established process is each month we are directed to pull a sample of the cases that we have, which we've administered the SNAP program. And then those cases are reviewed to determine whether or not all of the appropriate rules attendant to it have been followed. Okay. And where there are errors in those that are pulled, that becomes what the state's error rate is. Okay. And that we do our review, and then that review is affirmed by the Food and Nutrition Service. Okay. And so it is specifically about whether or not we served the family the individual or family that was eligible to be served, that we served them in the appropriate amount, and that we served them in the appropriate time. Okay. Where there is error in that, that's what makes up the error rate. Heretofore, there has not been from the federal government this idea of, I will say, penalizing this states for its error rate. We are now moving into a time where the federal government has changed that, and so any state, and it's not quite fair, but states that are in excess of 6% will receive a penalty that for the payment of the benefit, and that's brand new to the human services system.
Okay, and thank you for that clarity. That was great. So does that penalty? Where's that penalty applied? Does it affect the 25-75 split, or is it applied somewhere else? And who does it affect?
Okay, so the administrative cost, that 25-75, that is a separate issue.
That's it. Okay.
Okay. This goes to the benefit side of the house, which up until this year, for the entire life of this program, has been paid 100% by the federal government. Okay. So anybody that then the state deems eligible and the amount in which they would receive, that all comes to us through the federal government. Okay. This will change that in that if your error rate is above 6%, then a portion of that the state will have to pay. Okay. And so that would be a new cost to the state. And Representative Parkinson, why this is historic, okay, is that this really is a very different arrangement with the federal and the state government in the administration of this program. And the truth is, heretofore, the Department of Human Services has been about 92% funded by the federal government. And so therefore, there has been almost a sort of hands-off approach, okay, from the legislature, but that day is over, okay? And so just know that we are working diligently to reduce that error rate, to try to not have that penalty for being over 6%. But I want to let you know that is a heavy lift, and we're doing the best that we can. But it's a very heavy lift.
I get that, and I'll wrap up with these. One, just to make sure that show you that I do understand what you're saying. So the based on the error rate, that penalty will be in addition to the 75% match that we have to provide.
That is correct.
Okay, so
Yes,
I thank you for that clarity. I just want to leave with, I'll ask both of these questions at the same time, and you can answer both of them if you will.
Sure.
what happens if this body decides that not to approve the 75% match? That's one. Secondly, has the president's bill had any effect on the federal allocations or matches or anything either directly or indirectly related to child support and how we administer child support?
So if you were not to approve the cost shift in administration, we would be required to cut that portion of the labor force that delivers this vital support to eligible Tennesseans. We would be required to reduce our footprint for those people on our staff that do this work. And I would tell you that we are in the midst of an analysis of where that administrative cost is expended in our agency. And Representative Parkinson, I would tell you that it is literally woven through the entire fabric of our organization. So to not have that $58 million that I think is part of that 9-month request, it would be devastating to our ability to deliver the program.
Okay, and the second question.
And I'm sorry, and the second one again, please.
It was, has the president's bill had any effect on federal allocations, whether directly or indirectly related to child support? And if you can just clarify on your previous answer, I was more specifically concerned about what effect it would have on the people, not necessarily on your staff.
Right.
Right. And so.
Well, I'm sorry, I said at the beginning of that would impact our ability to serve individuals. Okay. So I mean, we would not have the ability to deliver that life-giving nutrition support to many Tennesseans. Okay. And then, so the answer to the second part of the question is no, nothing has been done has impacted our child support operation.
Thank you so much. Thank you for all that you all do too. Appreciate you. Thank you, Mr. Chairman.
Thank you. Next on the list, Representative Shaw.
Thank you, Commissioner, and thank you and your team. Good to see you.
Good to see you.
I've been following along with what you've been saying. A lot of questions I had been answered, but I'm still a little bit, I won't say confused, but perplexed about the error rate.
Yes, sir.
Can you go far enough in the weeds to help me understand the heavy lift of achieving the 6% of the error rate, if that question makes good sense to you?
It absolutely makes good sense. And so, so Representative Shaw, the way that this works is, let's just say you present yourself for eligibility for SNAP, okay? We have to put you through an extensive eligibility process in which we have to understand the household size, okay? And we have to understand income, assets, everything attendant to make the determination of, one, whether or not you and your family are eligible to receive. That's first.
Okay.
Then second, in what amount? And that's, again, based on existing federal criterion, okay? The error rate can come about when we would make a mistake in that. And let's say, and let's say that we would make a determination that Representative Shaw's family was eligible to receive $350 a month in SNAP benefits. Well, then the case gets reviewed, and let's say a step was missed, and you actually were only eligible to receive $300. Okay, there's been an error in that case.
Okay.
Okay.
I think, I
Yes,
get
sir.
that now.
Okay.
And you kind of answered, you got to be at a certain poverty level
That is
to receive those.
that is correct. Yes, sir.
Okay. Just, I know it's not old, but talk a little bit about the fatherhood program. Where are we on that right now, if anywhere? It was something I was very excited about, and I just would like to know if we are anywhere at this point.
Representative Shaw, we are somewhere and somewhere significant in our work in fatherhood. And let me just take a half step back and share with you, we launched this initiative because in the public policy construct that we have built in this nation, we excluded fathers from it. It was as if daddy didn't exist. And so, so we know that the breakdown of the family is a central challenge to the health and well-being of our society. And so we wanted to make a bold statement in Tennessee that fathers are not a luxury. Fathers are not a nice thing to have. Daddy is essential. Okay. And so, so we set out to construct an operation that honored that notion. And we started with a statewide conference to make that message. And we have evolved to now last year, we did a set of 10 grants to community-based organizations that are each operating. I think we've got a couple in each of the grand divisions that are engaging fathers, that are helping to build the capacity of fathers to connect fathers to their families. You know, one of the things that we have found in this work, and I'm stealing a quote from a very good colleague in this work. He said, some fathers are not deadbeat, they're just dead broke. Okay. And that what we want to do is help to build their capacity so that they can meet their obligation. But we also want fathers to understand it's not just about the nickel, okay? That dollar is important. But what we want is that father to be engaged in the whole life of that child. Okay. And so that's what our fatherhood initiative has been about and is building. And I will tell you that we are in the mid stages of a relationship with the National Football League Alumni Association that is going to allow us to take this work to the next level. So we are very proud of the work we're doing on the fatherhood front.
Thank you so much. And finally, if you can in any way describe what happens to us if we don't get the 58, if you didn't get the 58 million.
Yes, again, we would have to disengage a significant portion of our staff and find a way to continue to serve our SNAP rolls now are about what? 600,000 Tennesseans every month that we serve in the SNAP program. It would significantly encumber our ability to ensure that we got that vital benefit to them in the appropriate time and appropriate amount.
Thank you.
All right, thank you. And members, again, we're going to get to everyone. Just want to remind everyone, please stick to your question, stick to your answer. Here we go. Representative Chisholm, you're recognized.
Thank you, Mr. Chairman. First, let me say thank you all for the work that you all do. And thank you all for giving such detailed questions. So I have a non-technical question that I'm hoping to get a non-technical answer for.
We'll try.
Our millions of people at home who are watching us. So with the state of Tennessee declining to participate in the summer EBT program, I think you addressed it already, but I just want to get a layman's answer. In your estimation, we do still have all of the resources we need to feed our children this summer. Is that correct?
Yes, Representative, we absolutely do, and I do believe that the idea that we had an additional benefit, this body and the governor approved an additional $3 million for summer feeding, and we screamed from the mountaintops that those dollars were available. And I think that we ended up spending about 90% of those dollars. Okay, but know that we're dedicated to ensuring that every child has got access to those resources. But I feel comfortable that we have what we need to have in order to in order to achieve the objective. And just one other thing in that regard. Okay, I'm a big proponent, and having done this stuff at the federal, state, and local levels of government, okay, I will tell you without fear of reprisal, we do not need another program, okay? We have got a system where we've got just tons of ridiculous bureaucracy that takes $1.5 trillion and breaks it down so much and forces it into all these little silos that encumbers our ability to get dollars down to where it needs to go. So I don't need another program. I just need some common sense in the design of the system.
Okay, thank you for that. So let me pivot real quick
Yes, sir.
could you speak to child support? With the child support contract in Shelby, Knoxville, and Davidson County, I think there's about $77 million that's behind on collecting child support. What's you all's role in that?
So we have I think a vendor in Shelby County that does that work on our behalf. So there are some places in the around the state where the attorney general, the district attorneys do the work of the child support system. Okay, in some instances we contract that out to a vendor, and in that Shelby County area we do contract that out to a vendor, so they do all the work of ensuring that the child support system operates in that part of the state.
Okay. All right. Thank you so much, and thank you, Mr. Chairman.
Thank you. Next on the list, Representative Love, you're recognized.
Thank you, Mr. Chairman. Thank you, Commissioner, for your comments this morning. You stated that of the program last year for the summer feeding that we sponsored, we spent about 90% of those dollars. What percent of the federal dollars did we spend in the previous year?
Oh, are we talking about for the summer feeding program that we've been having for years?
Correct.
I would need to get, please, Lisa.
Yes, sir. We can follow up with you on that percent and how much was spent.
And the reason I'm asking is I've heard you say several times we don't need another program.
Yes, sir.
But I'd like to really compare. For example, if we spent 90% of the federal dollars, which were more, and then we spent 90% of the state dollars, which were less, it would appear as though there is a need for the federal dollars because they were expended in the year or two prior. That's why I'm asking that question. I know you're going to get the information back to me.
Sure.
Because we have to be careful. I think I know your point about no more programs, but when we know we have programs that have worked, I think it's incumbent upon us to fund those and to utilize those. I know we have a myriad of programs that are for feeding children and getting access to them for food. But I think we must have all the data before us as a body so that we know, again, for example, how much of the federal money was being spent. And even if the percent of federal money being spent was a lower percent than the state money, I would venture to guess that the totality in dollars of federal money was spent more than the totality of state dollars that was spent in the previous year. And so just, if you will, get those numbers to me.
We will get those numbers to you. And Representative Love, I would say that one of the things that I want to ask this body to help us do is, okay, wherever we have local sponsors, we can deliver. And so I'd like us to, we've got a heat map of where we're underserved. I want to say in any of those areas, I would like us to go together and say to the community, can we get sponsors? Because the sponsor, as long as we've got the sponsor, we can provide the resource. So it is about building up the capacity of the community to deliver the support.
Sure.
Okay. We will provide those numbers for you.
Thank you. And,
Yes,
and I'll be willing to talk to you about how to better utilize sponsors. I do know that many times, as it was with FSAG, many times when we go to the community and ask them to be engaged with state government, there is some apprehension because sometimes, not that this is the case with this program, but reimbursement is a long time coming.
I hear you. Yes, sir.
Financially. And I know a lot of programs did not get rolled out by smaller nonprofits because they just didn't have the capacity financially to roll those out and wait for
Absolutely.
the state to reimburse within the next year.
I understand that.
Thank you. Thank you, Mr. Chairman. Thank you for your patience.
All right, thank you. Last on the list, Representative Sparks, you're recognized.
Commissioner, appreciate your time. Do you have grandkids?
Yes, sir.
You do. When you have grandkids, it kind of changes your life perspective, I believe, you know. I want to talk about health, the health of our state. Tell us about the health of our state right now.
I think that the health of our state from where I sit it is strong. Okay. I do believe it can be stronger. And we serve vulnerable Tennesseans. Okay. And our mission statement is strengthen Tennessee by strengthening Tennesseans. And so that's sort of our part of this work. But I do believe that the health of Tennessee is strong. And I would just say in reference to your grandparent reference, I once heard an individual say that grandparents are not the same people that raised us. They're old folks trying to get into heaven.
Yes.
So,
Well, I want to kind of disagree with you for a second. You know,
yes, sir.
I've got a piece of legislation I think is one of the best bills that will be introduced this year. And I think it's going to affect your budget in the future. Before I get to it, I just want to share some health outcomes of our state. I started studying this the other day and I was just astonished and disappointed. The life expectancy of our state is about 72.4 years. Did y'all know that? You know what Russia is? Russia is like 73. We have one of the lowest life expectancies of any state in our nation. I think maybe Mississippi may be worse than us, you know, maybe Alabama. But among developed countries, we're one of the worst. And these health outcomes, whether it's childhood obesity, you know, we're talking about lack of food. A lot of our children are overweight, about 38% of our weight. Lee Reeves talked about type 2 diabetes, what it's going to cost us in this TennCare budget in the future. I think it's extremely alarming. Mental health, I think we rank at 49th. Proud to be born in this state, proud to live in this state, and I hope to retire in this state and raise these grandbabies that we're raising with my son-in-law and his beautiful wife. But I'm worried about the future of my grandkids, and I think we all should be worried about the future of the next generation, this current generation. The reason I say, I mean, we even rank below India. Think about that, folks. You in the audience, we rank below India and Russia. Man, that's sad. And what are we doing? What are the creativeness that we're doing? I'm going to tell you why I think it's the best bill. I think it's a better bill than the governor's scholarship bill. Okay.
Okay.
This bill benefits everybody. Governor's scholarship bill only benefits a few people, Chairman. A few. What my bill does is encourage people to eat healthier and cut tax off fresh fruit and vegetables. It's a no-brainer. It's a no-brainer. It's an affordability bill. I know Chairman's going to have a big fiscal note. Going to have a big fiscal note. But look at these health outcomes. Look at what we're spending. I mean, when the average Tennessean is 72.4 years, Russia is 73, India is 73. We need to take a hard look at this. But I appreciate you, and thank you for the great job you're doing. Appreciate your passion.
And Representative Sparks, my response here would be that it is necessary for us to take a concerted effort in this issue of the whole health of Tennessee. And part of the problem that we confront in the human services system is this fragmented, siloed design of the system, as if each program is kind of the silver bullet. And what we are proposing, and we are working with a couple of our partners in Department of Children's Services and the Department of Labor and Workforce Development, is a human flourishing initiative, where the idea is not just the delivery of benefits, goods, or services, but how do you help consumers create a pathway from crisis to stabilization to flourishing to thriving. That's the kind of Tennessee that we want to build.
Well, I like you mentioned silver bullet because I was going to ask you about 3 silver bullets, but I won't. I'll move on to the next session we have. Thank you, sir.
Thank you, sir.
All right, thank you. Ms. Baggett, did you have something to add?
I'm good, thank you.
Okay, thank you. All right, that's all the speakers that I have for today. We want to thank everybody for being here. Thank you, Commissioner. Thank you for your passion. Really appreciate that.
Thank you so much.
Thank you. All right, next on the list will be the Department of Labor and Workforce Development. We will ask Commissioner Thomas to please make her way to the front. Commissioner, good morning. Thank you for being here, and thank you for your patience. Running just a tad bit behind, but really good conversation to the last presenter. Just want to remind you that we will control the microphones up here, so once you see that red light come on, you're ready to begin. And members, just want to remind everyone and the folks who may be listening, everything is on dashboard as far as the documents go regarding the presentation. Without further ado, thank you for being here. Please introduce yourself. Begin with the introductions of who you have with you.
Thank you. Good morning, Mr. Chairman and members of the committee. I'm Denise Thomas, Commissioner for the Tennessee Department of Labor and Workforce Development. Joining me at my right is my CFO, Andy Summer, and to the far right is Administrator Troy Haley with the Bureau of Workmen's Compensation. Thank you for allowing time for the department to present our FY27 budget on this morning. Just a couple of opening statements before we get to the budget and obviously yielding to questions from the members is, the state of workforce development in Tennessee, we feel is moving in a very strong direction outside of Tennessee being a very strong state where business wants to come and thrive and grow or advance their businesses. We're seeing as a result of that a decrease in our unemployment rates. Our unemployment rate is around 3.6%. We've seen 87 of our 95 counties have lower unemployment. We're seeing for the first time our labor force participation north of 60%. As you can recall from even from my last budget hearing, it wavered around 59 and stayed there for some time. So we are seeing some gains in the number of individuals that are participating in the labor market. We're also seeing some advancements in the type of workforce development programming that we have at the department that's offering opportunities anywhere from youth to individuals that are coming out of incarceration. We can talk more about that in our budget. And it's because of that that we believe that we're in a very pivotal place in workforce development to strengthen Tennessee's global competitiveness, to make sure we have talent pipelines both for job openings today and those that we anticipate will come in the future. With our youth employment program, we've seen over 8,500 youth served, 1,500 employers that have come alongside us to provide mentoring opportunities for youth so that they can touch, feel, and actually interact and work. We're seeing our first pay timeliness on unemployment insurance north of 91%. If you remember, this was not a particularly good time for us, especially during the pandemic when your phones were ringing off the hook and we were having difficulty sustaining momentum and getting benefits paid. We have been able to meet that metric now for 17, 18 months consecutively with the advancements in our new system. Our workforce tablet program that this body approved for us, the General Assembly, and we're grateful. We're seeing 82 county jails and 92 facilities participating. We have over 33,000 learners. We're seeing people actually get workforce training and credentials on tablets while they are behind walls. And lastly, we've seen apprenticeship continue to grow in our state. We're seeing the highest number of apprentices in our history with over 12,000 and over 500 apprenticeship programs. And with that, we will start to talk about cost increases for our FY27 budget. Our first cost increase is for a Tennessee Works Hub team, which would establish 3 positions. This would continue to be a single point to serve. As we're serving business and industry, we find that there's growing needs and continued alignment and synergy among multiple state agencies. We've heard from businesses that they don't like us door knocking on them from 4 or 5 different agencies. They want a single entry point that can better address workforce development for them. Last November at the Economic Development Conference that we partner with Economic and Community Development, the governor launched Tennessee Works. We've already seen a growing demand for services from this initiative. And so this would identify 3 staff that would, their entire focus would be on anchoring this program to make sure that we are engaging and servicing an aligned workforce development strategy. That is to the tune of $705,000. The second would be the continuation of our youth employment program. You heard me mention some of the gains we've had from that program. This would allow us, this would be non-recurring for $8 million for us to continue to grow capacity. We want to broaden the program this year to expand it more into our rural counties. Agriculture continues to be a mainstay in Tennessee. It's not just on our seal. It's very much a core part of what we do. And there are youth that are in rural counties that don't want to leave the counties to have employment opportunities over the summer. Why not be able to take part in farming? Why not be able to take part in agriculture? So we want to create space to be able to do that. We were in the Upper Cumberland area, heard from several of our nursery farmers who would love to see this program and to start to teach kids about ways that they can participate in agriculture. We also want to focus more on youth aging out of foster care. It is so pivotal that we serve these youth before they age out. When they age out, it's very difficult to identify them or to have the data we need to be able to track them. Thirdly is our reentry employment program. Given the success we've seen from our youth employment program, we want to implement a model that's really based off the same sort of standard of subsidized employment. This is 1.5 million recurring. Essentially what this would do is the longer an individual stays employed, the amount of the subsidized match for us would go down and the employer would increase their contribution. But it would get more people the real life experience they need to help them really sort of prove themselves. And then gradually the employer would take on more of the cost. The fourth is our rural healthcare initiative. As you know, we were a participant of the shared savings with TennCare to advance rural healthcare apprenticeships across Tennessee. We have seen this program have tremendous success. Not just in apprenticeship alone, but also the expansion of training programs. And for that, we are proud to say that we have 86 counties that are being touched We have over 1,600 participants as we speak and over 56 apprenticeship offerings with this program. And we're hoping to continue to see that. That's 8.2 million for that of the shared savings. And then lastly is for our workman's compensation. I'm going to turn it over to Administrator Haley to address this one.
Thank you, Commissioner. Committee, Troy Haley, Administrator, Tennessee Bureau of Workers' Compensation. The request this year will be for a recording system to replace the current one that we have in all of our workers' comp courtrooms across the state. We have a courtroom in every office, Memphis, Jackson, Nashville, Murfreesboro, Chattanooga, Knoxville, and in Gray, Johnson City area. We had one in Cookeville. We gave that office up as a part of the COVID reduction, so we do our settlement approvals and hearings in the old Putnam County Courthouse. Be happy to answer any questions, and I appreciate your consideration.
Andy Summer, Chief Financial Officer. We're going to touch on some of our reductions this year. The first reduction is related to purchasing efficiency in our adult education division. This is realized through contract pricing and some savings there. It's $180,000. Our second reduction is related to workers' compensation and information technology savings. As we're moving from a legacy system to a vendor-based system, we won't have as many SDS charges. So that will be a $200,000 savings on that state budget as well. Our third reduction is related to our mines and labor standards division. And this is simply a reduction in equity. And also it's about $25,000 of system savings in that as well. So a total of $75,000 for equity and system savings. We also have a small reduction on workforce services contracts. This will be distributed around amongst our non-local workforce boards. This will have a minimal impact as we'll be able to supplement that with federal dollars, so they won't see any decrease in their grant contracts. And lastly, we did reduce 5 positions spread among state, federal, and other. So our position count this year will still be a -2 for the 3 positions we picked up. We did reduce 5 positions. The next slide is an update on the unemployment trust fund. The unemployment trust fund continues to grow at a healthy margin. We earned over $100 million in margin this year and ended up at a balance of $1,540 million. As many of you know, the employers pay the lowest taxes and tax wage base when that amount is over $1 billion. So we have a good margin there of $500 million. It would take a deep recession to get under that $1 billion threshold. So that's good comfort there. A particular note, this is probably the highest interest that we've ever recorded. We're earning a 3.25%, but we earned $49 million in interest this year. And just with our projections with the University of Tennessee, we project that we will still see growth in 2026 and 2027 as well.
Mr. Chairman, that is our budget presentation. We're happy to answer any questions from members of the committee.
All right. Thank you, Commissioner. And we do have several folks on the list for some questions. Let's begin with Chairman Williams. Chairman Williams, you're recognized.
Thank you, Chairman. Thank you, Commissioner, for your work. I know Chairman Hicks and I appreciate serving on TASER with you. It's a good opportunity for us to kind of get to see what you and your department are doing, and from your view too, really how it impacts locals. So thank you for your service there. I did have a question about the youth employment program. Since 2024, we've invested a little over $26 million in that program. From last fiscal year to this, there was a carryover of about $2 million. Your current budget asked for additional $8 million for that youth employment program. If you don't mind, could you just give me a little bit, I guess, more in depth about the system and the program and how it's working?
Thank you for your question. Thank you for your support and for your comments last year that helped us refine the program a bit.
Mm-hmm.
So what we're seeing is that initially this started out as would be a summer program, which meant that we would not get the funding until really halfway during the summer. So the carryover amount we've used to really start to build momentum for the program before we reach the summer, so that these kids are not working sort of half of the summertime. We've offered it year round. So what we continue to see is that there is pent up demand for the program. There are more kids kids that want to be served and we simply have spaces. We learned from what you shared with us, Chairman Williams, before. And so we started to limit the number that an employer could have. So we didn't have employers that, had massive amounts of kids that really limited other employers from participating. But what we're finding is that there's still a greater need to do this. And we want to have more parity with work-based learning and with Department of Education. So our goal this year is that we want to actually get into the schools well before they let out for the summer and start to pair these kids with employment opportunities. So based on the wait list that we're still seeing across the state, we know that we're going to continue to have kids that want to participate. And we want to diversify that by making sure those in-demand occupations sort of have a first seat at the table as well. Because we want to make sure we can start getting kids right-sized in the talent pipelines that we know we're going to really need and have a deficit as far as skill shortages. So we're kind of refining the program, but we continue to see that the number one thing that industry is telling us they would like to see us do, starting with their K-12. So that's really where it's at. It's successful, but we're hoping to do more. We're hoping over time that we can also work at a federal level for more allowability for our federal youth employment program to really learn from Tennessee, the state-funded program that this General Assembly has supported for more allowability. Right now, there are still some restrictions that really keep us from being able to grow it on both the federal and the state side.
Yeah, so the number of participants in previous years versus to how many you're going to be able to provide services to this year, what's that look like as far as total numbers of students?
I don't have an exact number for you, but I can tell you that we've had waiting lists each year for those students. We've also tried to avoid having sort of repeat students if we can, so that we give new students an opportunity to participate. But I believe we probably had I want to say it was 1,500 or 1,700 that we could not serve that needed to be served from last year to this year.
Yeah. And to your credit, you did take into consideration some of the concerns there that I had about the program. And I guess the only other thing would be, is there an actual cap on the total number of hours that your program does so that it doesn't become a permanent employment program?
Yes, it is capped. It's capped by the dollar amount. And so essentially, when we look at the wages that the students are earning, some of them are capped at $3,500, some at $4,000.
Okay.
That allows us to create more capacity.
Yeah. Is that cap based upon a duration of time or is it based upon an hourly rate and then however long it takes for that 3,500 or whatever the dollar number is per classification, if you will?
So the hourly rate is included in that, but some students, for example, if we have students that are involved in extracurricular, so they can't really participate after school, they may elect to get all their hours during the summer. So regardless of the flexibility of the program, is still going to be that cap. So they actually can work more hours during the summer, reach 4,000, or work fewer hours throughout the school year, but it still will be that 4,000 cap.
Yeah, if you don't mind, if you will, just get those numbers, not just the number served for FY 25, 26, and the number you expect to serve for 27, and what the waiting list was for those at the remainder of those 2 years. It'd be great to Chairman Hicks' office. Thank you very much.
Happy to do so, sir.
All right, thank you. Next on the list, Chairman Crawford. Chairman Crawford, you're recognized.
Thank you, Mr. Chairman. I want to talk to you about the reentry employment program. Can you tell me what the difference is between the reentry employment initiative funded in 2022 versus what is funded in the 2027 budget?
Yes, so the reentry, the global reentry program that the department has was really to serve those coming out of incarceration and in certain instances behind walls. That program is really just an extension of specialized services for individuals that are justice involved. This particular program will be simply for helping individuals get employment immediately coming out of release. So this would allow for individuals to get paid employment immediately that is subsidized, whereas our reentry program globally does not have funding to do that. It's providing job readiness, it's providing training, et cetera. But this would actually be a program that subsidizes employment, much like the youth. It would pair them with an employer, and we would subsidize on a prorated scale the amount of wages that are paid to the individual. The longer they remain with the employer, the less would be subsidized, the more employer would take on. What we're finding, even with some of the wraparound services and programs that we have attached to this, is there's still a need for that rapid reemployment where they're getting hands-on training and experience. As you can imagine, for some employers, they're apprehensive. This kind of takes away some of that apprehension by saying we will support this program, but if that person is found value as a member of your team, then you would need to take on more of that responsibility over time. We would still be there to support. We would still be there to oversee to make sure there's success of the program. But this is just a more specification, a more strategic initiative, if you will, out inside of our broader program that serves reentry participants.
So the subsidies that are provided, they go directly to the businesses that are participating in the program?
So yes, those wages would be to the employer.
And what are the projected numbers of participants this year?
So to begin with, we would serve, let me find my notes here. Give me just one moment. I believe we're capping it at 15,000 per individual. The dollar amount would be 15,000, and then that number would slowly come down. And I believe this is about 150 participants, I think we projected. I'm looking at my CFO here to make sure that's accurate. This is a brand new program for us that we've never done before. So we've just capped it at the numbers. Thank you. Yes, we've capped it at 15,000. So approximately 150 to 200 participants. It's just our initial estimate of people that we can serve. That would be a year that we would evaluate, obviously, how many we would serve and refine the program, similar to what we had to do on the youth side as well.
So the average wage ballpark for each participant would be what?
We estimate that to be about 15,000. That would give and take depending on which sector they go into. And again, what our hope is that some of these will go directly into full employment before they finish the program. So if there are individuals that are working with that employer the first couple of months, it's nothing stopping them from hiring them full on. That would then increase those wages to be reinvested or serve someone else in the program.
And what's your guesstimate of the retention rate you're shooting for?
We're hoping our retention rate is better than 75%. That's typically what we look at for our other programs.
Thank you. Thank you, Mr. Chairman.
Thank you. Next on the list, let's go to Representative Gant. You're recognized.
Thank you, Mr. Chairman. Commissioner, thank you for being here. The proposed FY27 budget includes 8.3 million non-recurring and TennCare shared savings to bolster and expand registered healthcare apprenticeship opportunities in rural communities. For FY25 and FY26, 6.4 million and 8.3 million were appropriated for rural healthcare apprenticeship programs, respectively. How many grantees and counties did these grants support that you can recall?
So, in the onset of the program, there was about 3 million in seed program to help get the program up that first, between February and June of 2025. We had 267 participants. There were 31 occupations that were supported in 52 counties. The following year, a full funding year for us, was roughly 10.4. We had 37 rural healthcare initiative grants that were awarded. We had 1,600 participants that were served. 1,000 of those were apprentices. 56 apprenticeship program offerings, and that covered 52 occupations, and a total of 86 counties were served.
Okay, all right. And what were the anticipated outcomes in terms of the new apprenticeships, credential completion rates, and healthcare workforce placement in the rural counties?
So our goal obviously was to expand apprenticeships because it is an earn and learn model, meaning they're working from day one. So the goal was that we can actually have individuals earning wages while they're contributing to healthcare capacity in their rural counties and also growing toward those certifications that we know would be needed. We wanted to absolutely tackle those that were most needed in communities. So we saw a lot of requirements or needs for EMT programs, for example, or LPN or nursing. And so it really depended on the county. We also looked at where individuals live versus where they would be, the adjacent counties that they would touch and serve. And so we've seen a lot of these programs grow and expand. So we worked a lot with the Board of Regents and a lot of their training providers to offer the programs. The goal is that once we get these stood up, these programs are now viable. So even beyond any of the funding that we would get, the programs are now there and in existence, and they were not before. So that they are standing regardless of what happens with the funding, that individuals now can go and take part in the training, get the credentials they need, and obviously grow healthcare capacity. We believe not only does this help with the health and well-being of our state, but it also helps with workforce and also limiting the amount of unemployment that we see in our rural counties.
Okay, great response. Thank you. Thank you,
All
Mr.
right.
Chairman.
Thank you very much. And I want to talk a little bit about micro-credentialing and the 26 budget. There were 6.3 million put out there to create this new program. Can you talk about how many programs have actually been developed, and also how many participants have we seen in the program?
So so this is our demonstration year for the program. We are, let me find my notes here. We have let out a few grants in that program. I believe we're looking to build capacity. There are a few in Memphis. I'm looking at my Chief Strategy Officer. Do you want to come up, Brianna? Because I think you have exact on that. This is our demonstration year for that. What we looked at, Chairman Hicks, was where we see the greatest amount of potential growth and where we see a lower number of credentials. And that's what we're basing on our year. But I'm going to ask my Chief Strategy Officer, Brianna Thomas, if she would elaborate.
Sure, Brianna Thomas, Chief Strategy Officer at the Department of Labor and Workforce Development. As Commissioner Thomas mentioned, this is our demonstration year, so we've accepted proposals based on identification of need. Of course, high demand in industry is always going to be our focus for occupations, and thus the training programs that align with that. Our goal moving forward would be those that would identify stackability towards a longer term credentials, and those that have progression towards career pathways, as well as those that are meeting growth in demand industry. So especially in East Tennessee, focus will be looking for proposals and programs that will focus on natural things with nuclear. Things that are taking place in West Tennessee currently have focused on healthcare, as well as some interested potentially in logistics. So lots of growth, especially as we kind of see the lay of the land in this demonstration year, and then be able to better define the framework for which we want to offer a competitive process to accept applications and across the state, and then thus offer funding for growth and micro-credentials.
So do you see that 6.3 being expended in this fiscal year in 26?
Correct.
Okay. All right. Thank you. Next on the list, I have Representative Parkinson. You recognize.
Thank you, Mr. Chair. And Commissioner, thank you for all that you do. Truly appreciate you and your team. I too, along with Chairman Williams and Chairman Hicks, serve on TASER with you, and truly appreciate your input. And as a member of that body, we have heard some of the draft report on the economic impact of the cosmetology and barbering industry, in our state, which when it's released will show an economic impact to our state in the billions. Your department now lists barbering and cosmetology as one of the high growth and in demand occupations in our state. And many of the barbering and cosmetology specialty schools and full schools, a lot of them offer apprenticeship models also as part of their strategy for training. With barbering and cosmetology being an in demand and high growth occupation in our state, under the summer program, can those dollars be used to pay for students to receive training in those schools during that summer period or all year round period?
So our youth employment program is paying for subsidized wages, not for training, but depending on the eligibility of the students that are interested, it may qualify for our youth program, our federal youth employment program, but there are some eligibility requirements to that. With that program, there is a minimum on what entry wage can be. And as long as it falls within that parameter, then yes. I think for us, for an apprenticeship side of the house, one of the things that we're looking to is ensure that when our students are engaging in cosmetology, whether it's barber, esthetician, et cetera, we would like to see a provision for more entrepreneurship and business training coinciding with that, because there's a reality that there's equipment that needs to be purchased. Oftentimes for these folks, there are booth rentals, there's insurance that's needed for their equipment, and we want them to not just be good at styling. We want them to have the entrepreneurial background so that it's a sustainable occupation for them. So when we start talking about opportunities to broaden that as a possible apprenticeship, those would be some of the things that would be a requirement in order for that program to be approved at the department level.
Representative Parkinson.
And thank you for that. And I truly appreciate that. Most of the schools or the specialty schools that I come in contact with, and I come in contact with a lot of them, they do offer, that's part of their curriculum and part of their training. But let me ask this another way. I think you spoke to earlier, there is a certain amount in the aggregate that's tied to each student that is in the
Yes.
summer program. And is there any wiggle room or ability for you to look at that aggregate amount and utilize it for those students to go into those say a summer intensive with one of these schools, right? Because where I'm coming from with this is this. Yeah, I understand that we want to pay the students, but I also understand that we can plant a seed for the students to pay themselves, right? And because, these students can, for instance, natural hair is 300 hours. Those 300 hours can be accomplished in that time, between school ending and school starting possibly. And so they would be licensed professional. My daughter is an example of that. She became a licensed professional in the state of Tennessee at the age of 16. And now she's a celebrity stylist at the age of 21. And so I think there's a huge, especially with this being an in-demand and high growth industry, I think there's a great opportunity for us, if you have the flexibility, to be able to put some of these students into, these specialty schools or full college school and get them licensed before the summer is out.
So Representative Parkinson's, what I will say is that between our federal and state portfolio, there are other programs that fund training. And we tend to look at that first. That's not all exhaustive, but we tend to look at that first, because what we don't want to do is necessarily tie up the employment wage program on training when there are other pots that can do that. The emergence of the youth employment programs was simply there was no other subsidized pot. So this was a new program created by Tennessee, but there are opportunities to be trained. We have an eligible training provider list that we require our providers to go through so that we can ensure rigor, et cetera. And so our training dollars are based on eligibility for that. And so there is a program that's there, and we will look at a student's eligibility. And obviously, if there's opportunities, we're certainly not inflexible. If there are opportunities to make sure that we're giving students a viable path, regardless of what that is, we'll look into that as a department.
I think that's great. And I truly appreciate, all of the work you're doing, and want to leave you with this. We still have a soft skills challenge in our state. Pull up at any drive-through in Memphis, and depending on how the day is going, you might get it, right? But I think and I said, I've already told you this, so it's not a surprise to you, that we should make an intentional effort in becoming and branding ourselves as the most customer-friendly state in the union. I think it'll go a long way. It'll go a long way with convention recruitment, business recruitment, and preparing our people, for the workforce. And so again, thank you for everything you do. Truly appreciate you.
Thank you.
All right. Thank you. Chairman Hawk, you're recognized.
Thank you, Mr. Chairman. Everything was fine till the gentleman from Memphis talked about barbers and hair, and that just kind of that triggered me there. That kind of set me off. So the talons came out. Commissioner, thank you so much for your work.
Yes, sir.
And we don't want to miss out on thanking Tia. Tia does some great work for us in
She
the
does.
offices, and we certainly appreciate Tia. The slide we've got up on the screen there, as we're talking about, and this is out of everything else you do, is so well, but I want to focus on the Unemployment Trust Fund. Do states have flexibility to collect $0 should our Unemployment Trust Fund reach a particular level?
I'll let you answer that.
No. Andy Summer, Chief Financial Officer. No, all employers have to pay a certain tax based on their reserve ratio and based on their tax wage base. No one really can pay. There's a new higher tax rate of 2.7% that you have to pay for a couple of years, and then you transition into the tax tables on a long-term basis.
Chairman Hall.
Thank you, Chairman. And the reason I asked that, I look at $49 million interest income, which is great, but I think about if business had those funds to invest in their business, where would we be and what will we be doing? So I guess I know that's more of a federal issue where we are told you must do this, you must do that in that particular instance. But it certainly is something to have a discussion broadly at a level at the federal level that what if? Could a business be put that way? And thank you very much for explaining to us that we are over the particular rate that should recession hit at any particular time, which who knows. But we're well prepared to address that through our businesses and our employees at the time. So thank you very much.
All right, thank you. Members, I have no one else on the list, so I do want to thank the department for being here. But before we break, let me go to Chairman Williams.
Thank you, Chairman Hicks. I just want to take an opportunity. It's not every day that you see in the audience your childhood best friend's daughter and the best man in my wedding. And she's been sitting in the back all day. She is new to Johnson Poss, and she's sitting in Kirby. She's sitting in the back. Her name is Sydney Luff. She's the firstborn daughter of my best friend from high school, Brian Luff. So make her welcome. Yeah. He would be, he and I agree that we take every opportunity at all possible to embarrass our children in front of other people because it makes them stronger adults. So thank y'all. Thanks, Sydney.
All right. Thank you, Commissioner. Thank you for your presentation. Thank you for answering our questions. So without objection, we will go back into session. And that does conclude our budget hearings for this morning. We will return at 1 p.m. to continue the remainder of the budget hearings for today. So without objection, we do stand in recess. Got to run upstairs. Tom.